Good morning, Supala.
Good morning, ma'am. Good morning, ma'am.
Yeah, all set.
Yes, ma'am.
My face.
Hello. Yes, ma'am. Yeah. He has already come. He was assisting from sound system. So he was muted me, so I couldn't answer you.
Okay. Cecilia messaged me that he is come.
Yes, ma'am.
Yes.
Ma'am, voice is clear from my side.
Yeah, very clear.
Yeah. And Shweta, just let me know when to post this pre-test in the YouTube. Okay, just remind me. Yes, ma'am. Ma'am, we have 1 minute to go for 9 and we have 125 participants now. Okay. So, as soon as Lata ma'am will say, we will start the recording and we will give the pre-test also. Yeah, fine.
It's exactly 9
Participants are joining now.
we can start. Yes.
Okay, okay.
You can share the pretest link in the chat box now.
Okay, okay, ma'am. Post it. And Shweta, one more thing, there is no change in the program. Program will
Yeah,
go
ma'am.
as it is, okay?
Yes, ma'am. Noted, ma'am.
Yeah.
Actually, registrations were all more than 1,500, but people have to join.
Ma'am, should I post the pre-test in the chat box, ma'am?
Yes, yes. Please post the link
Okay.
so that exactly 9 o'clock Subala can start the announcements and welcome.
Susanji, वो वाला प्री टेस्ट वाला जो है ना, वो अभी चैट में डालना है हमारा भी यूट्यूब में थोड़ी देर में। तो ठीक है।
Here I have posted the pretest link in the chat box. Kindly find the Google link and fill the pretest. Thank you. Subala, you can start. Yes.
Okay, ma'am.
Recording in progress.
Good morning, everyone. So I will start this session by starting with a saying that anyone who keeps learning stays young by Henry Ford. So I hope and I'm sure all of us would love to stay young. So keep learning new things in our new life. So let's remember the Almighty God to begin the day with the blessing. A very good and warm welcome to one and all on board with us for this 2 days faculty development program, a short-term course in the forensic nursing jointly organized by Director General of Health Sciences, Nursing Division, in collaboration with College of Nursing, AIIMS New Delhi, and Department of Forensic Medicine and Toxicology, AIIMS New Delhi, and ECO India. On behalf of College of Nursing, AIIMS New Delhi, and Department of Forensic Psychiatry, Forensic Medicine, AIIMS New Delhi, it is immense pleasure to welcome you all for this virtual program. We have our esteemed guests of this program, Dr. Randip Guleria sir, Director AIIMS New Delhi, and Dr. Rati Balachandran ma'am, Organizing Chairperson, Dr. Lata Venkateshan ma'am, Principal cum Professor, College of Nursing, AIIMS New Delhi, who is a great leader, motivator, mentor, and always enthusiastic to learn the new things and innovations in learning and teaching. That's her hobby. Another eminent organizing person and professor and the head of Department of the Forensic Medicine and Toxicology, AIIMS New Delhi, Dr. Sudhir K. Gupta, who is a very experienced expert and excel in his own field and agreed to enlighten and empower the nursing fraternity from across the country. I also welcome all the resource person of the 2 days faculty development program. Now I would like to welcome all the participants, especially the faculties from the different colleges and schools of nursing across the country. So as Sweta has announced, I request all the participants to fill the pre-test which has been shared in the chat box. So now to begin with the first session of our faculty development program, our first speaker, Madam, need no introduction, but just for formality, I have to introduce our madam, our lovely Dr. Lata Venkateshan madam, Professor cum Principal, College of Nursing, AIIMS New Delhi, who is a renowned personality, always shows the enthusiastic to learn the new things. Now I request Madam Dr. Lata Venkateshan to deliver her session on Introduction to Forensic Nursing. Please, ma'am.
Ma'am, you are muted. Yes. Yeah. Thank you, Subala. We request the participants to attend the pre-test. The link for pre-test is shared in the chat box. So we will wait until 9:15 for all of you to complete the pre-test. Those who are joining late, you can still continue to attend the pre-test. So we will start the session 5 minutes later. And for the participants, those who are attending in YouTube also, the link is shared in the chat box. Please attend the pre-test. Shweta, can you show the pre-test link in the screen as well? So that those who are joining will know that pre-test is going on.
Sure.
Participants are again asking for pretest link. In chat box, it has to be posted once again.
Participants in the YouTube can also fill the pretest because it has already been shared in the chat box.
Their audio. Shweta, you will respond to chat box comments. Yes, there is somebody who is finding difficult to log into pretest link. Yes. Subala, Ms. Nicole has joined online.
Actually, ma'am, I cannot check that. Well, just let
You
me
are not
check.
able to see.
Yeah.
Okay.
No, ma'am. Nicole.
Not still. Still should not join, ma'am.
Maybe she will join exactly at 9:30 because it is midnight for them.
Manjeet, can you confirm, please, if Nicole ma'am has joined?
Not yet.
Okay, thank you.
So shall I start my session because many are completing pre-test? Shall I start?
Yes, ma'am. Your screen is visible, ma'am. And you're audible also, ma'am. You can start, ma'am.
Am I audible?
Yes, ma'am. Yes, ma'am.
Yes.
Over to you, ma'am.
Good morning, everyone, and a very warm welcome to all the participants, resource persons, faculty members, and the dignitaries who have joined this program. College of Nursing AIIMS, along with Department of Forensic Medicine and the Nursing Division of Ministry of Health and Family Welfare, has taken this maiden initiative of introducing the faculty members to the concepts of forensic nursing. Most of the nurses are practicing their care with a holistic framework, which includes the care of body, mind, and spirit. But are we addressing the legal needs of the patients? With forensic nursing established, the role of a nurse was altered to include the legal needs of the patients. So, the forensic nursing includes the needs of the victims of crime as well as the needs of the perpetrators of the crime and also the victims and perpetrators of crime who are presenting themselves with mental disorders, and also caring for their families and support systems. So the definition of forensic nursing goes like this. Forensic nursing is defined as the application of the nursing process to public or legal proceedings and the application of forensic healthcare in the scientific investigation of trauma and or death related to abuse, violence, criminal activity, liability, and accidents. If we look at the evolution of forensic nursing, it is a relatively young discipline in nursing. In India, we have not yet started forensic nursing formally with courses conducted. But of course, there are nurses who are working in forensic departments. But for practice of forensic nursing is not limited to forensic department. It is integrated with our daily practice. And it was so interesting to learn how forensic nursing has evolved over the past 30 years. A strong advocate for the forensic nursing specialty was started in the United States by Miss Virginia Lynch. She pushed to have the specialty recognized and helped to form programs in US for proper education in forensic nursing. Early vision of forensic nursing focused on the role of the death investigator. And slowly it has expanded to involve sexual assault nurse examiners. In short, it is known as SANE. In the early 1990s, a group of nurses, they recognized the lack of appropriate care for victims of sexual assault, and they developed training for nurses to prepare them in order to properly assess the patients, collect evidence, document findings, and interface with the legal system in caring for victims of sexual assault. The same group of nurse clinicians established International Association of Forensic Nurses in the year 1992. And today, the association has spread its wings to 40 countries, and there are more than 6,000 members who are part of this International Association of Forensic Nurses. We are very fortunate that we could connect with the president of AIIMS, and she has immediately consented to be one of the resource speakers in this short-term course. So she is going to be explaining about the association, their activities, very interesting, and I request all of you to please visit the website of the association. It has got many standards, the protocols, free virtual training programs, and whatnot. Complete guidance to practice as a forensic nurse is posted in their website, and we need to visit that. And I am also anticipating to have an Indian branch of the AIIMS soon with the help of the president. And Indian Nursing Council always takes the initiative to update Indian nurses with international trends. Our curriculum is on par with the international curriculum, and the Indian nurses are able to perform in the global scenario, meeting all the requirements of global citizens. On that note, it is again another initiative of Indian Nursing Council that they have included forensic nursing Indian laws as one of the subjects in the undergraduate nursing curriculum. It has raised the eyebrows of many people. Forensic nursing, that too in undergraduate curriculum, is it really necessary? And many have an idea of forensic nursing means it is only dealing with postmortem or the care of the family members after the death who are subjected to criminal investigations. We have a very limited understanding about forensic nursing. Because the curriculum has included all the concepts related to forensic nursing, and at the end of this 2 days course, I am sure the outlook of the faculty about forensic nursing will expand and change, and we be able to empower our nurses with the concepts of forensic nursing integrated into the daily practice of nursing care. So this subject is placed in third year BSc nursing, and it is given 1 credit hour, that is 20 hours. Indian Nursing Council has recently introduced credit system in which every 20 hours of theory classes will be given 1 credit, laboratory demonstrations will be given 1 credit for every 40 hours, and every 8 hours of clinical experience will be given 1 credit. So this course is designed in such a way to help students to know the importance of forensic science in total patient care and to recognize forensic nursing as a specialty in the professional nursing practice. It has also listed down competencies because now the present Indian Nursing Council curriculum is revised as a competency-based curriculum. So the forensic nursing competencies include the students are able to identify forensic nursing as an emerging specialty, and they must be able to explore the history and scope of forensic nursing practice. And they must be able to identify the forensic team, their roles and responsibilities of forensic nurses in total care of victims of violence, and how to preserve the evidences. And also to develop basic understanding of the Indian judicial system and the legal procedures. There are 5 units, and every unit has its own objective. And the unit 1 has to be implemented for 3 hours, and it will deal with the concepts related to forensic science, violence, sexual abuse of child and women.
Ma'am, sorry to interrupt, ma'am. Ma'am, can we make it full screen, ma'am, like in slideshow?
Yes. Sorry. It is visible, no? I think I am not able to make it full screen.
Yes, ma'am. Visible, ma'am.
Slides are clear and visible, no?
Yes, ma'am. Yes.
Yeah. Okay. So unit 7, I'm sorry. The second unit, it explains the concepts of forensic nursing and the scope of practice for forensic nurses. It also explains about how the scope of forensic nurses are included in the Indian Nursing Council and State Nursing Council Acts. And Unit 3 is one of the biggest unit, which is for 7 hours. And this unit has included comprehensive forensic nursing care of the victim and their families, and how the forensic nurses will work as a team member along with other members of the forensic team. So the students will be able to learn about the responsibilities of all the members and also provide comprehensive care for the victims and their families. It includes not only their physical aspects, their psychosocial requirements, cultural and spiritual needs, and legal needs especially. So, I'm sorry. They will be able to assist the forensic team beyond the scope of their routine practice. Unit 3 also includes an important component, that is evidence preservation. As forensic nurses, preservation of evidence is one of the important responsibility. So this unit will empower the nurses how to observe evidences, recognize the evidences, how to collect the evidences and preserve them, as well as document the evidences, because it may be required to be produced in the court in case of criminal and traumatic events, and forwarding the samples for forensic examination. So it is all very interesting and essential for us to know how to function within the framework of law. And Unit 4 is it again for 3 hours. This will help the students to develop basic understanding of the Indian judicial system and the legal procedures. We need to understand the rights of the victim as well as the rights of the accused, and the functions of the Human Rights Commission, and what is the role of nurses within this legal and judicial system, and function effectively as a forensic nurse. And the final unit also explains about the Indian judicial system and the laws, and it explains the overview of Indian judicial system at multiple levels, at district level, state level, at the national level, and what are all the laws guiding the criminal activities, and how it is being reviewed by the Indian judicial system in case of sexual assault and other crimes. That will be explained in this unit. So if you look at forensic nursing, it is not limited to only these aspects. It is very interesting to see that forensic medicine is expanding its scope with latest technologies. The emerging disciplines in forensic sciences are disaster identification, keloscopy, forensic engineering, meteorology, blood spatter identification, voice print analysis, retinal scanning, forensic entomology, forensic anthropology, whatnot. It is a very, very interesting and expanding field, and nurses have got a very promising future in the field of forensic nursing. And this short-term course to develop and orient the faculty in forensic nursing is a collaborative initiative between Department of Forensic Medicine, AIIMS New Delhi, and the International Association of Forensic Nursing. So why AIIMS New Delhi? Because this course is incorporated as part of Indian Nursing Council, and it is the responsibility of every college to implement this curriculum and learn about it. So AIIMS New Delhi has taken the maiden initiative to orient all the faculty members. Why means forensic medicine departments are available mainly in medical colleges, not in every nursing college or any nursing college. So the colleges of nursing which is attached to medical colleges, especially government medical colleges, will have the privilege of having the faculty from forensic medicine department to teach as related to forensic nursing. In that way, we are very fortunate. When I approached the HOD of forensic medicine, he immediately accepted, and he delegated his faculty members to assist us in designing the program. And in no time, over a short period of time, we could design this program and implement. And all of them are experts. If you look at the Department of AIIMS Forensic Medicine, it was started in the year 1957. And at present, apart from the routine medico-legal works, the department is also engaged in multifarious activities of teaching, training, and research. It is involved in medico-legal postmortems, clinical forensic medicine services, and court-related works. The department is also providing expert opinions in referred cases from courts, National Human Rights Commission, CBI, Crime Branch, Delhi Police, and investigating agencies from other states as well. The department is running various laboratory services like Forensic Histopathology Laboratory, Toxicology Laboratory, and DNA Laboratory. Forensic Anthropology Laboratory, first of its kind in the country, is being developed in the department. And this department is well equipped as per international standards and will act as quality training center and provide mentor facility for the entire country. The expert and experienced professor and HOD of the department and the faculty members of forensic medicine department of AIIMS have consented to empower the nursing faculty across the country with the essentials of forensic nursing. And there is overwhelming response. We have received more than 1,500 registrations, but we could accommodate only 1,000 people. Rest all will be attending in YouTube, and if required, we are willing to host the program again, because we have 3,000 colleges, almost 3,000 colleges of nursing in India, with every college having 30 to 40 faculty members. The need is huge, and we have to train all the faculty members, and Indian Nursing Council is also planning for faculty development programs. So all the faculty members will be enlightened about forensic nursing, because when we were students, we were unfortunate to learn the concepts of forensic nursing. So now we need to upskill ourselves so that we will be able to guide the students effectively. So I am sure this 2 days of short-term course will empower the faculty members to learn about the basic concepts of forensic nursing and how the procedures are being carried out. And further, you can get connected with us. Any virtual visits or any further expertise sessions are required. We are always willing to host programs, and we are looking forward to associate with International Association of Forensic Nurses and take forward forensic nursing as a great scope of practice for nurses in India. So thank you everyone, and we are looking forward for more interactions in future with discussions on case reviews, watching forensic exam videos, and different kinds of training like how to be an expert witness, how to be a nurse examiner of sexual assault, how to be a nurse examiner of intimate partner violence, and there are so many other interesting courses are there related to forensic nursing. So stay connected. There is a Twitter handle, tweet at forensic nurses. Join the Twitter handle for the updates happening at the international forums. So stay connected and enjoy 2 days of great learning. And there will be a post-test link at the end of 2 days, which will be shared, and the certificates will be issued upon completion of the post-test. And please give us the feedback so that we can improve the performance in the future similar events organized by us. Thank you all so much.
Thank you so much,
And I
ma'am.
must thank EPO for the technical support, because they helped us immensely in organizing every technical requirement of this program. And I must be thankful to Madam Rati Balachandran, the additional director of Director General of Nursing from Ministry of Health and Family Welfare, who immediately accepted our proposal and facilitated approval from Ministry and helped us to host the program along with the ECHO. Thank you.
Thank you so much, ma'am, for highlighting and just explaining in the very detail about the newly added subject in the nursing curriculum by the Indian Nursing Council. I'm sure that all the participants might have got what is the importance and why we need to study about this forensic nursing in this new curriculum. So thank you, ma'am, for making the participants so aware about the objectives and the reason behind why we are organizing this 2 days workshop and a short-term course in the forensic nursing. Thank you once again, ma'am. Sweta, can you please confirm whether Miss Nicole has joined?
She has joined, ma'am. Ma'am is co-host, ma'am.
Okay, yeah. Good evening, Miss Nicole from India.
Hey guys. Hi. Hello. How are you guys?
Yeah, we are very good, and we are just looking forward to interact with you. So now I would like to introduce our second speaker, Miss Nicole Stallman, who is a forensic nursing specialist, providing the training and technical assistant, and also the president of International Association of Forensic Nurses. And she dedicated her career to the forensic nursing. She received her sexual assault nurse examiner certificate in 2015 and advanced certificate in 2016. Prior to her work with the International Association of Forensic Nurses, Ms. Nicole has served as a clinical program manager, as an emergency department nurse, and also an adjunct instructor at Georgetown University. Ms. Nicole also served as a secretary to the Maryland District of Columbia IAFN chapter, which was an active member of DC Sexual Assault Response Team, and she also served as a secretary, president-elect, and president on the foundation board of IAFN. So now I request Ms. Nicole to deliver the session on scope of forensic nursing, settings, areas of practice, role and responsibility of nurses in the forensic nursing. Over to you, Ms. Nicole.
Perfect. Thank you so much. And hello again, everybody. Can you guys hear me okay?
Yes. Ms. Nicole, Ms. Nicole, this is Lata Venkatesan. Thank you so much for consenting. And we have principals and deans, faculty members from various colleges across India, and all are really excited. And we are looking forward to have an Indian branch of International Association of Forensic Nursing with your guidance. Thank you.
Excellent. Yeah, thank you. And thank you for having me. Perfect. And I am able to screen share my presentation, correct?
Yes, ma'am. You can, ma'am.
Okay. Let's see. It looks like I'm not able to.
Ma'am, can I do it for you?
Sure. Absolutely.
You have to keep your presentation open first, then click share screen and open the window.
There we go. Perfect. Now it's allowing me. Can you guys see that?
Yes, yes, it is visible.
Perfect. Okay, let's see. Okay, perfect. And thank you for the introduction. So again, my name is Nicole Stallman. I'm a forensic nursing specialist with the International Association of Forensic Nurses. In my role, I provide training and technical assistance as well as education to anybody who is looking for this information or wants this information. And I also practice clinically in 2 different facilities in my area. So I am a forensic nurse examiner, seeing patients across the lifespan. And so today we're going to talk about the scope and standards of forensic nursing practice. We're also going to include information about the roles and responsibilities of forensic nurses. And we will talk about general clinical practice areas. And then we're going to wrap up the presentation today with general resources that I can share with you guys that are free and available for you guys to download. Let's see. So because I get pretty theatrical with my hands, I'm going to take my screen off if that's okay. Let's see, or close my video. Perfect. Let's see. And my screen does not want to advance. There we go. Excellent. So this first page here is this first slide is just to talk about the International Association of Forensic Nurses, so IAFN. So the IAFN is viewed and recognized as the world's premier forensic nursing organization. And since 1992, we have led the world in defining the forensic nursing practice where health and the legal systems intersect. And you're going to hear me say that a time or two, but it's definitely that intersection where healthcare and the legal system intersect. So we work to define and advance the global research agenda to enhance nursing's evidence-based response for the needs of the forensic population. We work to develop, promote, and disseminate information internationally about forensic nursing science. And we serve as a global network for forensic nurses to exchange ideas, serve as mentors, and enhance their practice. And you can find a lot of our information at forensicnurses.org and a lot of resources at safeta.org. So SAFE as in sexual assault forensic examiner, technical assistance. So safeta.org. Perfect. So this first slide here really outlines the forensic nursing scope and standards of practice. So in conjunction with the American Nurses Association, so the American Nurses Association, the ANA, as well as IFN, we have developed the first forensic nursing scope and standards of practice in 1997. And later the second edition was developed and updated in 2017. And it identifies the expectations for the role and practice of forensic nurses. It describes and outlines a competent level of forensic nursing practice and professional performance as it applies to all forensic nurses. And so developing a set of scope and standards of practice is important for forensic nursing within your country as it sets a precedence for the nurses' roles, their responsibilities, and simply, it outlines or defines their scope and standards of practice. So it provides that outline and framework for how that forensic nurse is able to practice. And as nurses, as forensic nurse examiners, overall, right, we know we practice and adhere to established set of policies and procedures to help guide our practice. So scope and standards of practice describe the who, what, where, when, why, and how of forensic nursing practice. So the who constitutes the forensic nurses, and the what encompasses the definition of forensic nursing. So forensic nursing occurs when a need exists for care, knowledge, wisdom, even leadership or practice, anytime or anywhere for any patient or for any need. The where is captured by the environment where the patient is in need of the care, any kind of information or even advocacy. The how of forensic nursing practice is defined in the ways, means, methods, and manners that forensic nurses use to practice professionally. And the why is defined as the forensic nursing's the response to the changing needs of society to truly achieve that positive patient outcome. And not just the patient, but not just that positive patient outcome, but the families and the communities that we're also seeing and treating. So I should say the depth and or extent of an individual and the forensic nurse's practice, so within that total scope of that forensic nursing practice, truly depends on that nurse's education, their experience, their roles and responsibilities, the setting that they're in, and that setting is defined by policy and the population being served. So what is, or how do we define forensic nursing? And you can see here, forensic nurses are registered or advanced practice nurses who have received specialized education and training to address the acute and long-term health consequences of patients impacted by violence. This is a systematic approach to preserving both the acute and long-term consequences of patients. So again, this is where the health and legal system intersect. So on this page here, you're going to see sane and safe. And just to define the two, sane is the sexual assault nurse examiner. So this is a nurse who has been specially trained to provide comprehensive care to sexual assault survivors. Safe is that sexual assault forensic examiner. And this is that umbrella term where you're going to see this is an RN or advanced practice provider. Maybe it's a physician, physician assistant, any kind of advanced practice, etc. A safe, so they are the ones who are specially trained to provide comprehensive care to sexual assault survivors, but both of them, sane or safe, they demonstrate competency in conducting a medical forensic exam and has the ability to provide that expert witness testimony. So the key here is that it's less about provider qualifications versus the training that that individual receives to practice effectively and provide for that complex healthcare needs of that patient. Okay, so this slide is animated. I'm just gonna, there we go, just populate the two there. So you'll see here that on the right side of your screen in that right box, you'll see forensic nursing standards of professional performance. And on the left side, you'll see standards of forensic nursing practice, which will go in depth in the next few slides. But before we get into them, I just wanted to say that, so forensic nursing practice is truly grounded by the bio, psycho, social, and spiritual education of the nurses and or providers, and truly using that process or nursing process to assess, diagnose, and treat individuals, their families, communities, and populations affected by violence. So you'll see there the quality caring model. So Joanne Duffy, who is a theorist, she developed the quality caring model, and it sets a theoretical and foundational framework that supports all aspects of the same role. So this nursing theory, recognizing what research about the same practice already finds, that having a caring relationship with a sexual assault patient achieves best outcomes for both the patient and the community. And I really say the patient, family, and communities quite often throughout this presentation today, but that's truly what it encompasses, right? It's beyond, it's the patient, yes, we're caring for, but it goes beyond that for the best possible outcome. Okay, so again, you'll see on the slide here, standards of forensic nursing practice and forensic nursing standards of professional performance. And we're going to cover both of these on the next few slides. And these are standards, but we know with all of nursing, there are additional sets of competencies that the nurse must meet to practice independently. And to also ensure not only competency, but that they're practicing confidently in their role as well. All right, so let's jump into these. So the first slide here is the standards of forensic nursing practice, and you'll see the slide is also animated, so I'm just going to populate everything onto this slide and talk through it. All right, so again, found within the scope and standards of forensic nursing practice. You will find here the standards, and these describe the competent level of forensic nursing care as demonstrated by the critical thinking model known as that nursing process, right? So the standards, they include assessment. So the forensic nurse can collect pertinent data and information relative to the patient's health, death, or situation. And this will include, for example, a past medical history, a social history, maybe history of present illness. The second bullet there is diagnosis. So the forensic nurse analyzes the assessment data to determine diagnoses, problems, and/or issues related to clinical findings. The third bullet is outcomes identification. So the forensic nurse identifies expected outcomes for a plan individualized for that patient or situation. And this is unique to the patient, right? So every single patient is very different on how we encounter that patient or what their needs are. So that outcome is going to be very individualized to that patient. The next bullet here is planning. So the forensic nurse develops a plan that prescribes strategies to attain expected measurable outcomes. And this is to promote and facilitate healing. The next bullet is implementation. So the forensic nurse implements the identified plan, utilizing resources, of course. So all of the resources that they have available and collaboration amongst team members to make sure that there's an implementation plan. This also includes coordination of care and health teaching and promotion, which employs a healthy and safe strategy. So providing that patient with information, for example, on disease process or topics, as well as healthcare needs that are consistent with the patient's values, their beliefs, cultural and spiritual needs or preference. So that is all encompassing within these bullets here. And then the last piece here is evaluation. So the forensic nurse evaluates progress towards attainment of goals and outcomes. And this is an ongoing approach in assessment, right? And it's that support of that patient, their families, and communities overall. All right, the same slide here, I'm just going to pull up, let's see, just so we can get the animation out of the way. I'm sorry for this. Let's see. Oh, one more. Perfect. So the standards of professional performance for forensic nurses describe the competent level of behavior in that professional role to support the patients, to support their families and communities affected by violence. So these activities include ethics. So the forensic nurse, they practice in an ethical manner. So integrating that code of ethics. And as nurses, we practice with compassion and respect and certainly advocate for our patients. Culturally congruent practice. So the forensic nurse practices in a manner that is congruent with cultural diversity and inclusion principles. So demonstrating respect, equity, and empathy for all patients. Communication. The forensic nurse communicates effectively in all areas of practice. And that goes into collaboration. So communication and collaboration are huge with this group, right? So the F&E collaborates with patients, families, and other key stakeholders. So for example, we're collaborating often with members of the multidisciplinary team or the sexual assault response team. And that could include law enforcement, advocacy, prosecution, you name it. And not just collaborating with them, but ensuring that we're building alliances and making sure that we're building a team, effective team, to make sure that we're caring for these patients as best we can. And I'll talk more about multidisciplinary teams in a few slides. The next bullet here, so the activity can also include leadership. So the forensic nurse leads within the professional practice setting and profession. So they're displaying leadership. They lead by example, and they certainly create environments that is respectful for all individuals. Another activity is education. So the forensic nurse seeks knowledge and competence to reflect current practice and promotes future thinking. And our practice changes, and it changes often, right? So we are promoting an environment of lifelong learning and willingness to change. And that is key in this world. Evidence-based practice and research. So the forensic nurse integrates evidence and research findings into practice using critical thinking and speaks to the value of research. Quality of practice. So the forensic nurse contributes to quality nursing practice by maybe achieving certification or seeking out additional educational opportunities. Let's see, we have professional practice evaluation. So the forensic nurse evaluates one's own and others' nursing practice. So this is a self-reflection and evaluation and adhering to general guidelines. There's also resource utilization. So the forensic nurse utilizes appropriate resources to plan, provide, and sustain evidence-based nursing services that are safe, effective, and fiscally responsible. And then the last bullet here is environmental health. So the forensic nurse practices in an environmentally safe and healthy manner. And this can be in a singular experience, but also beyond even to a global one. All right, so this slide kind of captures some of the roles and responsibilities of the forensic nurse. So the forensic nursing roles and practices, they can vary. They can certainly vary depending on the facility where they practice. They can certainly vary depending on the established policies or procedures that were drafted. They will certainly vary depending on the population that is served. So some forensic nurses only see pediatric patients, and maybe that's all they see. Maybe some see adult adolescent patients, but they do not see pediatric patients. It really just depends. It can vary regarding the type of violence that they may see. Maybe one program will only see sexual assault patients, where another program will see sexual assault patients plus intimate partner violence patients or domestic violence patients or attempted homicide patients, etc. It just truly depends. But you see here on the slide the typical duties and responsibilities of the forensic nurse examiner. So we're going to go through some of them. And the first one here, so providing nursing and medical care. And we're addressing it, right? So think about your ABCs to caring for patients. Medical always takes priority or precedence over any kind of forensic care. So airway, breathing, circulation comes way before F for forensics. So just so we know that, collecting any kind of evidence comes later, it's secondary. I have here, so obtaining a medical and forensic history. So again, we're going to collect a past medical history, social history, a family history, definitely collecting a history of the assault or history of present illness. And I will tell you that history of assault or present illness helps guide my medical forensic exam. And then in talking about guiding that medical forensic exam, we're going to perform a physical assessment. And that includes a full head-to-toe assessment and a review of all systems, including eyes, ears, nose, throat, neuro, cardiovascular, you name it. We're going to conduct that full head-to-toe assessment. It will also include, potentially include a pelvic exam that includes the use of a speculum, or maybe it's an anorectal exam with the use of an anoscope. It just depends on that patient and that patient encounter. And I do want to include here that it could be a focused assessment. So if the patient 100% knows what happened to them, maybe if they say or they endorse, I was only orally assaulted, I'm going to conduct a thorough oral assessment and collect evidence. But if nothing happened to them vaginally or anally, I will not subject them to that exam. So it can be focused. Let's see another bullet here. Identifying, collecting, preserving, and documenting forensic evidence. So we're definitely identifying injury, such as bruises, abrasions, lacerations, petechiae, subconjunctival hemorrhage, pattern injuries or pattern of injuries. Can be anything. Collecting evidence using the evidence collection kit, and not just collecting that evidence, but properly maintaining that chain of custody. Photographing injuries, so capturing photos of injuries and in a systematic approach. So what I mean is if we're doing a full head-to-toe assessment, then we're absolutely collecting photos if the patient consents to photos. But I'm taking photos if there's an injury on the forehead first before I'm going down to maybe their legs and taking photos there. It's really head to toe assessment there. And then documenting. So documenting that full medical forensic record, it as one record, and documenting all findings and any communication that we had with providers or law enforcement or any other stakeholders. All of that is encompassed in one documentation or one record. Providing information for referrals. And this is for the patient. So maybe we're offering follow-up referrals, mental health services, or advocacy services. Maybe we're assisting them with appointments, appointments to obtain medications or more blood work or lab work, whatever they need to have done. Let's see, provide fact and or expert witness testimony. So as forensic nurse examiners, we can certainly provide fact testimony. So we're providing information about the care that we provided to that patient and documented what we saw, or we're providing that expert witness testimony, providing that opinion. Let's see, we have the other bullet here is to collaborate with various stakeholders. So of course, we're going to collaborate with advocacy, law enforcement, prosecutors. Maybe it's somebody in student health services. Maybe it's communicating with their caseworker, social worker, whomever it is, just making sure that we're collaborating with the team. And it's truly to build that alliance with your team. All right, so I think I mentioned this before, but the primary focus of the sane or safe must be the healthcare needs of that patient who's experienced the violence. Again, it's that systematic approach. So we're starting ABCs, and forensics comes down the way, right? So we're not so much necessarily focused on that kid. We must ensure that we're focused on their short and long-term healthcare needs of that patient. The kid and evidence collection certainly comes secondary. In saying this, the medical forensic exam is one complete exam, and it's a systematic approach to supporting that patient's needs, offering resources, and guiding them back to a more safe and healthy, both physically and mental well-being. I think I see a hand. Is that for me? A raised hand? Maybe I should continue, I don't know. I will continue, I'm sorry. All right, so the forensic nurses identify and treat patients affected by violence, right? So patients affected by violence can be identified in a variety of ways. They can even report to the facility in a number of different avenues. They can present to the facility on their own. They can come in with maybe law enforcement. They can seek advocacy services first. There's no one clear path for all patients. And some patients can be seen in the emergency department, maybe inpatient, even clinical settings, but we'll talk about that more in a few slides. And I just want to mention this, that sometimes patients don't always endorse a violent crime, or they don't always endorse that an assault occurred to them. They sometimes minimize injury and or assaults. But this is where our nursing and medical skills, our assessment, our diagnosis and treatment, and our approach to a trauma-informed care truly come in and play a vital role for positive patient outcomes. So this slide identifies the settings or areas of practice, and please know this is not all-encompassing. There can be a variety of areas or locations where a patient can present. So forensic nursing practice, or forensic nurses, they practice independently but collaboratively as needed in various settings, wherever and whenever health and the healthcare and legal system intersect. The locations where the forensic nurse practice can vary depending on the location, the funding source as in who's paying for the exam or reimbursing for that exam, or how those supplies are funded, the education experience of everyone involved, the community and country standards, any legal influences, or a combination of these factors. So these areas can include, but certainly not limited to, hospital, So for example, the patient can present to an emergency department or an inpatient setting. They can be in a clinic. They can even be in labor and delivery. It just depends. You can see patients in a long-term care facility. There's investigative on here. So this could be a medical examiner, maybe a coroner or law enforcement agency. And when I say that, it's important to know that we work collaboratively with law enforcement. We do not work for law enforcement. My hat is a nurse, and it will always be a nurse in this setting. You see Child Advocacy Center, Family Justice Center, maybe correctional or confinement facilities such as jails, prisons, or detention centers. You can certainly see these patients maybe in student health services or the gynecologist office. It really just depends. So the core of forensic nursing specifies the definitions, roles, behaviors, and processes essential to practice. The boundaries of forensic nursing are both internal and external, with sufficient resilience to adapt to the ever-changing societal needs and demands. The intersections reflect where the boundaries of forensic nursing practice overlap with those of other stakeholders so this is by virtue of nursing's unique application of that common body of knowledge, environment, and focus, and specialization. So specialization in forensic nursing incorporates a multitude of subspecialty areas specific to the forensic healthcare needs of patients and communities, and across settings, populations, and systems. So what's important here is that regardless of the practice setting, the forensic nurse integrates knowledge of nursing science, criminal justice, public health, forensic science, and issues related to violence and trauma across the lifespan in providing a holistic forensic healthcare approach to preserving the life of patients, their families, communities, and populations served. So this slide talked about the multidisciplinary team and the sexual assault response team. And as a team, we work collaboratively throughout the response. We build policies and procedures and in a collaborative approach or in a collaborative way around the response to sexual assault. We each define our roles and responsibilities and understand what each other or what each partner can offer in response to the resources for patients and how to draw that professional connection. What's important here is that we are constantly building a multidisciplinary team and that approach to responding to patients who have been victims of violent crimes. You'll see a few individuals listed here on the slide, but the team can include these individuals, but again, it's not exhaustive, and we can certainly add anybody to this table that we need. So this can include the medical forensic examiners, so forensic nurses, SANE, SAFEs, and this is to understand our roles and responsibilities, right? And what we can and cannot do within our scope of practice. So advocacy, connecting with local advocacy agencies in our area, law enforcement, prosecution, the crime lab, definitely want crime lab at your table, any kind of local, state, or tribal representatives. Maybe you have teachers, social workers, caseworkers, anybody at student health services, just to name a few. All right, so this slide just represents our membership. So IFN membership, this year for you guys, it's $50 for a regular membership for nurses. It is $45 for nurses. And yeah, I just wanted to highlight just a few member benefits, and you'll have access to forensic nursing education. So we have over 50 hours of free education to our members. It does include continuing education or contact hours if you need them, or a certificate of attendance. There is an opportunity to invest in your professional development as a member. You will have the ability to network with forensic nurses around the world. We have over 6,500 members, and we certainly offer other discounted education as needed. Oh, and yes, of course, we have a Journal of Forensic Nursing. So as a member, you do have access to the online Journal of Forensic Nursing. The next few slides are just general resources that I wanted to share with you guys, and they are free to download. But I will make sure that all of these links and all of this information is shared, and then it can be distributed to you guys as needed or as necessary. So this first one here is Intimate Partner Violence Nurse Examiner course, and it is 15 contact hours if you're interested in taking that course. It's available on our website, and it comes with a cost, but discounted rate if you're a member. So I encourage you to become a member first, and then take these courses if you're interested. We do have an established education guideline, so our guidelines serve as a standardized body of knowledge for forensic nursing practice, and they define patient population, they establish a minimum duration of instruction, they include recommendations for trainers and educators. They definitely specify recommendations for clinical preceptorship and all of that. And all of these are free for you to download. We also, so we were finding in our area that we have physicians that were interested in taking the course or wanting to know more, just general information. So this is a free course for all healthcare providers. It's caring for the sexual assault patient when there is no scene in sight. And there is it is 2 hours of education based on the neurobiology of trauma, courtroom testimony, the coordinated community response, and the medical forensic exam. So if you're interested, it's 2 hours and it's free to anybody, and CNEs and CMEs are also available. And then the National Protocol for Sexual Assault Medical Forensic Exam. So these are free to download, and these are protocols that help, it includes overarching and operational issues, as well as details that medical forensic examine process. So there are 2 different ones. There's an adult adolescent as well as pediatric, and again, free for download. The National Best Practices for Sexual Assault Kits, a multidisciplinary approach. So this document goes into great detail about the multidisciplinary team, sexual assault evidence collection, including appropriate timeframes for collection, and even down to which body part. And the document also includes how to handle evidence at chain of custody, just transparency about the kit overall. And then this last one, again, free for download, is our training standards. And this includes information on just used for training medical forensic examiners to provide care to patients in a victim-centered, trauma-informed approach. And again, if you visit safeta.org, all of those are available for download. And I say this to having that these are established and available, but I encourage you to use them and incorporate them into your practice how you see fit or however you need to. I'm not sure how we're doing on time, but I just wanted to say this is my last slide. And thank you very much for the opportunity for me to be here today and to talk through scope and standards of practice of forensic nursing with you guys. And if you have any questions, please feel free to reach out at any time. We're happy to help you. We're happy to collaborate with whatever you need as you guys are developing this program. So thank you and have a wonderful day, you guys.
Thank you so much, Ms. Nicole, for sharing your experiences and explaining about the scope, role, and responsibility of a forensic nurse, and regarding the setting and ethics that she has to follow, and which all the practice area that a forensic nurse can work in future, and explaining about the International Association of the Forensic Nurses. And thank you so much once again, and I would really like to thank once again for staying awake in the midnight there in the US to interact with the more than 800 nurses across the country, that is from India and other country also. Thank you so much, Ms. Nicole, to be with us and to share your experiences, especially during this faculty development program. I hope all our participants had a quite information from your talk. Thank you so much once again.
Thanks, you guys. Have a great day and a great session. I appreciate you all.
Yeah. Any questions? We have 5 minutes. 10 it is.
Yeah, if any of the participants has any query, you can come up, because we still have Ms. Nicole with us. Not so long, I agree. So if you have any query, please come up.
I can certainly share those links that I mentioned.
Yeah.
Dr. Lapa, I'll share those with you, and then I will have you distribute as you.
Yes,
Okay, perfect.
yes. So,
Everything that we talked about today, I'll make sure is shared in an email with you.
yes.
Okay.
So thank you, Nicole. We look forward. We will continue to associate with you. And I think we require your support in strengthening, establishing forensic nursing in India. Probably we look forward to have an Indian chapter of your association, enroll members, and continue to host sessions in the field of forensic nursing. Thank you.
Excellent.
Thank you.
Thanks, you guys. Have a wonderful session, and I look forward to working and collaborating with you all.
Yes.
Thank you.
Thank you. Thank you. Good
Well,
night.
once again.
Yes. Good night.
Thank you.
Yeah, moving forward to our next speaker, Professor Tabin Milo. He has completed his MBBS from JIPMER, MD in the Forensic Medicine from AIIMS New Delhi in the year 2000. He is a Fellow of International Academy of Medical Sciences and member of the National Academy of Medical Sciences. He has joined as a faculty in the Department of Forensic Medicine and Toxicology, AIIMS New Delhi in the year 2003, and working as a professor and the faculty in charge of the Forensic Toxicology Lab. He has been actively involved in teaching, research, and handling medical legal cases in the department for the last 23 years. His field of interest and research is in the forensic toxicology, field of clinical forensic medicine, and has extensively worked on the relation and influence of alcohol on accident and crime. He has immensely contributed to the development and upgradation of the forensic toxicology lab in the department. He has guided many MD and PhD students and has more than 100 research publications in the national and international journals. He is executive editor, Journal of Forensic Medicine and Toxicology. He has taken part in the international scientific conferences and the workshop, and he is a professional advice for the Forensic Expert Service to CBI, National Human Rights Commission, Delhi Commission for the Protection of the Child Rights, Supreme Court and the High Court refer cases and the crime branches. He has immensely contributed to the solving of many challenging and sensitive forensic cases of national and international importance in his successful professional career of 23 years. Now I request Professor Tabin Milo to deliver the session on forensic science and medicine, history and importance, forensic team and their responsibility. Over to you, sir.
Thank you. And very good morning to all the delegates. I find a very good number of participants are there. It suggests that the nursing professionals are very excited about this profession. And I thank Dr. Lata for organizing this conference on forensic nursing. And I believe this is a need of the hour, because since I joined forensic medicine in 1997, we used to actively work in emergency, seeing cases of sexual assault victims, child abuse, and all kind of violence. And we used to go there for examining and preparing the report and do our duty. But I always felt in the emergency department, we were little alone, because there are doctors, physicians there are nurses there, but we would be running around making the things, and we had to do everything. So I felt if there was a forensic nurse available in the emergency department, it would have been half job done and it would be very smooth for us. That was the thought already, which I carried, and I believe it is not too late, but our country can take a step towards forensic nursing specialty, and it will be really a great help to the crime investigation, a forensic nurse is also part of the team. And, every one of us are a student of science. And from the science, we have joined medical field. So doctors, nurses, dentists, we are in the field of medical science. I would share just a very general talk. My talk be on a general talk, and let's go through the slide. So my topic was forensic science, medicine, history and importance, forensic team and responsibilities. So I will be giving a very general view, and Ms. Nicole has already spoken about forensic nursing, and Dr. Lata has already introduced you about the forensic nursing. So I will give a general view on the forensic science and forensic medicine, what is importance, what is relevance, and how we can work as a team. Now, all of us are science students, and we use our science knowledge for helping solving the crime. And forensic science, in a broad definition, it is application science. That is of any science for the criminal justice. When we apply science for solving the crime, it becomes forensic science. And in that forensic science, we have many branches: medicine, dentistry, and nursing is a part of it, anthropology, toxicology, engineering. So any branch of science, if we are using that science for crime investigation and solving the case, it is forensic science. And we in the field of medical science, we can contribute immensely to the crime investigation. And from there only the field of forensic medicine came. Just like, medicine, cardiology, orthopedics, like that. From medicine, the branch came out forensic medicine, which is applying the medical knowledge for crime investigation. Similarly, forensic nursing, you can apply the practice of forensic nursing was helping us in crime. So that is a broad sense of forensic nursing. Now I want to just highlight about forensic science. It is a very big subject. I cannot, it is beyond this lecture to tell whole thing about forensics, but I will give a little glimpse about the role of forensic science and how forensic sciences advanced in these years. In 1800, somewhere in 1800th century, we, the people of science, started using anthropometry for documenting the identity of a person. Anthropometry means documenting the body measurements: height, weight, length of the arm, fingers, size of the body, size of the chest. These are all anthropometric measurements. So the people of science started using this anthropometry, the measurement of body, for identifying a person. This was the beginning of the identification of a person. After some years came dactylography, fingerprint, which is still in use, because anthropometry had lots of variation. So the people of science thought, dactylography is more accurate for identifying the person. And this is still one of the most accurate tool for identifying person, and it's still in use, and it's very helpful, simple and helpful. After some time came DNA, when we went to the molecular level, physical level to the molecular level. In 1980s, a DNA scientists, they told the world that DNA is a very good tool for identifying a person. And DNA is unique, every human being. And DNA identification can be done through any biological fluid, biological sample like hair, skin cells, saliva, blood, semen. And also, even though samples are very small, that can give a DNA profiling. And the DNA profiling is now one of the most authentic way of identifying a person, an authentic way of connecting the suspect to the crime scene, authentic way of identifying the human remains in a mass disaster. So this becomes a very excellent tool. So this is a nutshell, just an example I wanted to show how the forensic science has grown in these few years and has become more sophisticated and accurate. Now came from the forensic medicine. From the field of medicine, a brain stem forensic medicine. And this became a very important part for the crime detection, where the medical doctors, they become an important part of the crime justice. And in simple terms, forensic medicine is the application of medical knowledge for the purpose of law and administration of justice. We use our medical knowledge for solving the crime and helping the court to administer justice. This is the simple definition of forensic medicine. And there are many other disciplines like clinical forensic medicine, forensic pathology, forensic toxicology, forensic radiology, and now forensic nursing, forensic dentistry. I believe in India, forensic medicine is developed to a good extent, and forensic dentistry is on the way of development. But the dentists, they have taken initiative to develop forensic dentistry. And now I always feel forensic nursing has to be developed because they are a very important part of medical field who can contribute in the crime investigation. So this conference, I feel, it will contribute in sensitizing forensic nursing professionals to look for a career in forensic nursing. And I suggest the forensic, the nurse association to take the initiative, and there will be a great help in the crime investigation team. Now, briefly, I would like to just highlight the history of forensic medicine. Forensic medicine dates to about 4000 BC in the civilization of India, China, Egypt, Babylon. These are the four civilizations, where we can have some documents telling about the mention of medical legal issues. And one of the well-known documented medical legal document is the Hammurabi Code of Hammurabi, which was enacted by the 6th Babylonian king Hammurabi, one of the oldest documented medical legal code. And if we talk about autopsy, there is we can look back 44 BC, in the history of Roman Empire, when Julius Caesar was assassinated by Tabin. There, a first documented report is there by the physician. And when the physician just observed the body without opening the body, and he told that second stab wound, which was between the first and second ribs, is the fatal one. That was one of the first recorded medical legal opinion given by physician. Of course, there was not a classical autopsy. The physician just observed it externally and gave his opinion. And one of the first autopsy which was conducted was in 1302 in Italy, in the place called Bologna by Bartolome da Marignana. The first autopsy, a documented autopsy, was conducted in 1392. And the first forensic medicine book was published in 1603 by Italian physician Fortunato Fedel. So I am just talking very general talk about forensic science, forensic medicine. So I'm not going deep so that you are sensitized about what the forensic science means, what the forensic medicine means, and where the forensic nursing is also standing. Now I believe forensic nursing professionals, when you apply your nursing practice for the purpose of law and administration of justice, I think that is forensic nursing, like forensic medicine, forensic nursing. You are applying nursing practice knowledge and skill for the purpose of law and administration of justice. And I very much feel every professional has a role in contributing to the justice. And the forensic medicine, after joining forensic medicine and being in the forensic medicine for nearly 24 years, I have realized that this forensic medicine is so vital for giving justice. I remember some of the cases, many of the cases in the court, the judgment has been just based on the forensic doctor opinion. That is the role of the forensic professionals in administration of justice. We don't see how much effect it has, but giving justice to the society is a great contribution. Giving justice to the society is a great contribution. If your professional service can contribute to the giving justice to the people, for giving justice to the victim, for helping the judiciary to administer justice through the correct judgment, I believe that is one of the greatest contributions you can give to the society. And I realize this more and more with time. I can say many stories, innumerable stories, but one of the I remember one letter. It was written by Association of the Victims in Gujarat riot. There was a Gujarat riot in 2002. And in that communal riot, many people were killed. Many number of people, adult, women, children, and lots of people lost life, and there was a mass burial also. And it was a horrible crime, and here a team of AIIMS were asked the CBI to help them. And we formed a team, and I was part of the team. And we had to exhume the body. We had to examine all the bones, their belongings, prepare a detailed report about the identity of all the biological remains. It was a 1 week complete task we had to do, but finally we compiled a very good authentic report, and including the DNA, we applied the DNA for identification, and we could identify majority of the bones that we had recovered from the grave. And there has been there has been judgment has also been given, and the accused has been convicted. After some years, we got a letter from the Victims Association of those cases. They wrote a very emotional letter telling, we are so thankful to the team. And they wrote a small poem for all of us, the AIIMS team. for helping us to get the justice. And they are heroes that we thought there is no power. No, we won't get justice. The system is so corrupt, and we did not have hope of getting justice. But your team delivered justice for us. You are like a people sent from God. And that was the poetical description. They wrote a very emotional letter to us, and I still have the copy of that letter, because that is a blessing, to the society. We can contribute as a medical professional, as a nursing professional. So I'm talking about this out of the box, but just to tell you about the importance of forensic medicine, forensic nurse. Now, I just wanted to show this box. We are all working for administration of justice. Judiciary is working for administration of justice. The police investigating agencies, CBI, crime branch, NIA, all they are working for administration of justice. And we, from the field of medicine, forensic medicine, forensic nursing, forensic dentistry, we are very important part of this administration of justice, and its contribution can be immense and vital. And so I wanted to sensitize all of you, the nursing professionals. I desire that this forensic nursing field is developed, and forensic the nurses, they take up this forensic nursing specialty and be part of this forensic team. And the areas where I have seen the need of the forensic nurses are in an emergency, in the trauma center. AIIMS, we have emergency center for adults, emergency center for the pediatrics, and we have a trauma center. I always felt if we had a nursing professionals in this emergency, pediatrics emergency, and the trauma center, because the nursing professionals has the great ability to, take care of this patient of violence, maybe sexual assault, it may be abuse, it may be any kind of domestic violence. They have a great role, and they are the most need. They can assist in examining the case, documenting the case, and collecting the biological evidence, sealing it, maintaining the chain of evidence, and and helping the forensic doctor to do the job more efficiently, effectively, as a team. So this is the need of our IT, and I feel all of us are very important part of this justice system. Now, I feel these are some key areas where forensic nursing professionals can contribute. Of course, these are the areas my next speakers, they will be covering the topics. In India, in 2017, the government took an initiative to make one-stop center for examining the victims of sexual assault, abuse, domestic violence, violence against elderly, violence against child. They want to develop a one-stop center. What is this one-stop center? One-stop center means, for example, in emergency, we dedicate a space, a one-stop center there. The victims of sexual assault, victims of child abuse, they examine there where, medical aspect, legal aspect, and psychological aspect of the victim is taken care of in our place. Forensic medicine doctor will be available, forensic nurses will be available, the physicians who will be treating, they will be available. There will be a psychologist to, counsel them. the victims of these assault cases and victim survivors. So the medical, legal, and psychological aspect of the victims can be taken in one place. Now, what is happening? The previously what is to happen is first the physician will examine, then the forensic doctor will examine, then sometimes the gynecologist may be called, sometimes the pediatrician may be called, and the psychiatrist may be called. They used to be on call, and it used to be a really time taking. But this one-stop center will give a place where all these specialists are already available in one place, and the victim will be examined comfortably, and all the things will be documented, and all the medical, legal, and psychological care will be taken care in one place and very comfortably, and it will help the victim. And one of the areas where nursing specialists are very helpful is examination of the sexual assault victim. In India, there are many laws covering the sexual assault. We have many laws. IPCs, we have 370 IPC regarding the rape. Then we have protection of child from sexual offense, POCSO Act 2012, to prevent child sexual abuse, and protection of women from domestic violence Act 2005, sexual harassment of women at workplace 2013. So we have all these acts to check the violence against child and women. And in these areas, I feel when the cases pertaining to this act, when we have examined the case, forensic nursing specialists will be really helpful, all of us, to do justice in this case. And also, I always feel crime scene investigation team also should have a forensic nurse specialist, because they have the knowledge of medicine, they have the knowledge of the physical body, the biological samples, and they can handle the biological samples more scientifically, with wisdom, knowing the medical and legal applications. So crime scene investigation team also is an area where I feel a forensic nursing specialist can contribute. And in areas, I also feel in mass disaster. In mass disaster cases, I witnessed many mass disaster cases, including the Upar Cinema fire accident, Gujarat riot case, Ganesari train accident case in West Bengal. I have been there and seen how chaotic it is when the forensic doctor land up there to collect samples, document it. And there, the work division is very important. And I want to say, if we had a forensic nurse specialist team also help us in documenting this biological evidence, the findings, they will be very helpful, because we come from the medical field, so we have the medical knowledge. And when we handle a human body, a person with medical knowledge, the best person to handle the body in a scientific way. And recently, I remember we had been to Chitrakoot, a place called, I think it is in UP, in 2020. There was a racket of child abuse case. A serial child abuser was detected. He has been abusing child for the past 10 years. And when the CBI inquired, there were about 50 child victims of sexual child abuse. And the person was arrested, and we examined the accused also, and the CBI requested we have to examine the child victim also for the evidence purpose. So we had our team, my team had to go to Chitrakoot, CBI to pass our team to the Chitrakoot, and we halted in a hotel, and there was a district hospital. We converted it into an examination room. And we had to examine around 25 children who were brought there. And it was a very tedious job, I felt. And fortunately, we had many female doctors, my junior doctors, forensic doctors. We had 2-3 female doctors. They were part of the team. And they made our job very easier. I felt if there was a forensic nurse with us in the team, it would have been so helpful to be part of the team and help in these cases. Because when we examine the child, when there is a female victim, there is a child victim, female nurse, I felt they can deal the cases very efficiently. The children are comfortable with ladies. If the nurse, examine the child, they're very comfortable. If a female doctor examine the child, they are comfortable. So they tell that history comfortably, they cooperate in examination, and they can be comforted, they can be counseled, and their handling is much better. So I felt that again, so much forensic nurse would have contributed in examination of the child sexual victims. There was one case which I have done in 2020. So these are the areas I feel where we need forensic nurse specialists, and I believe in the coming days many nurses will take up this profession and they will be part of this forensic team. So thank you for hearing me patiently. And this was my brief talk. I hope it will be of some benefit to you and it will encourage you to develop this forensic nursing specialist. Thank you so much.
Thank you, Tabin sir, for sharing your experiences in all the very difficult and very challenging and very sensitive situation that you have come across, and you could find out that what is the importance of the nurses in the forensic nursing and which all are the areas that there will be the need for the nurses in this situation. So thank you, sir, once again so much, and to being with us and to exploring that requirements and the needed areas of the nurses in this forensic nursing. I think this is the right time that INC also has added the forensic nursing in the curriculum, and the right time for this faculty development program also. Tabin, would you like to say something?
Yes, thank you, Dr. Tabin, for exploring the importance of forensic nurses, which they can contribute. There are a few questions in the chat box. Somebody has asked, anybody has appointed forensic nurses? In India, where are the forensic nurses working? And someone want to share your some of the interesting personal experience in the field of forensic medicine.
I think regarding forensic nurse specialist, I don't think there is any course created as a forensic nurse specialist. Though the nurses are working, I have seen the nurses working in the emergency, helping us in the collection of evidence, sealing us, even examination, they have been part of it. They are already practicing, I think, but they are not designated. I believe in the coming days, the nurses will take up a special training in this forensic nursing, and the hospital authority, they should use their services in an emergency trauma center, like psychiatric nurses used in the psychiatry, intensive care nurses used in the intensive care, like the forensic nursing specialists, they should be used in this, especially in the emergency where the trauma and sexual offense cases is handling. The hospital authority should take this initiative after the nurses are getting trained. And I believe in the future, also the forensic nursing specialist course should be specially created. First, we start with medical colleges, where they can be a part of the forensic medicine, and be a theme in the forensic case examination. And regarding interesting cases, there are many cases. I cannot tell the whole thing, but there are many interesting. I have traveled all over the country because of forensic, because crime does not have any jurisdiction. It occurs anywhere, and most recently the Sushant Singh Rajput case, the lockdown case. CBI asked us to travel down to Bombay into lockdown, and I was leading the team. We had to do all cases during the lockdown time, and there is so much pressure in the media from the higher authorities, and that becomes very international case. So the forensic doctor also, some pressure comes work and deliver the justice as early as possible. There was one recent case which everybody is aware of this. So, and there are also many international cases come in Goa and all their foreign nationals, crime against the foreign nationals when they die. That also sometimes is very challenging. And I have traveled to J&K. Then the J&K is a very difficult case again. They have gone to exhumation, exhumating the bodies there, and the public hue and cry, and Sopian, there was Sopian rape and murder case. There are so many cases which I can narrate, but I cannot tell. There is no time to tell the stories. Any other?
Yes, Doctor. Yeah. Gujarat University in India is offering in forensic nursing. And Indian Nursing Council has included in the basic nursing curriculum itself. And I feel that forensic nursing is not a separate role. It should be integrated in the practice of every nurse. Because we may come across the victims of intimate partner violence or the sexual abuse, and children getting exploited. All these we might come across in our day-to-day practice. So I feel it is one of the integrated role of every nurse. And we have to have an eye for looking for the evidence, preserving the evidence, documenting the evidence, and forwarding to the appropriate departments. This should be known to every nurse, and it is very good that it is incorporated in the undergraduate curriculum itself now. So we will be able to help the legal needs of the patients. We heard all these years only legal protection of us, how to protect ourselves from the litigations. But legal needs of the patients, how to help them to have successful legal outcomes, is also one of the responsibility of the nurses that is getting enlightened now. Thank you very much, Doctor.
I totally
somebody is asking, how did you? Yes. Somebody has asked, how did you examine the 25 children in that incident which you were describing? What was the technique used for examining them? Is it ethical to reveal in the public forum?
I cannot reveal the report and findings, but at least I can tell how we divided the work. See, there were 25 children. We examined around 13 children per day, and we divided our job. We had around 6 doctors, team of 6 doctors, including 2 lady doctors. So we had we asked the parents to come along with the children, and then first they interacted with lady doctor, our forensic doctor. They took the history and relevant forensic history, and then they examined the case. And in the examination, our male doctors also assisted them. And history examination, and they used to come from one room and history examination. They exit through the another room, so that actually the privacy is also very important. We made it very very privacy was maintained. Comfort was maintained. Children were, kept very comfortably so that they don't get inconvenience, any harassment, any kind of. So it was done very confidently, but in a very keeping them very comfortably. And very smooth flow. We divide. Division work is very important in forensic team. If the division work is very good and we do our role effectively, the work goes very smoothly. Thank you.
Yes. Thank you, sir. Thank you very much. I think it's a very, very interesting field for nurses to work in forensic nursing. Hope so. We will have forensic nurse specialists in India coming up shortly. Cadres have to be created so that they can use the skills and knowledge, whatever we are learning is translated into practice. Thank you very much. Thank you. Somebody is asking the one who has nursing degree, how to become forensic nursing specialist? I think there is no answer as of now because there is no postgraduate courses available to work as forensic nursing specialist. I'm sure in future it will come up. And another question, excellent session. I want to ask that medical forensic gives strong validation for the solving medical legal cases, but do we need the validation for the medical team too, due to corruption? And this is a very sensitive question.
Yeah, actually, we have to be. I believe, there has been. I definitely agree. There has been some time a very bad image about forensic doctors, that there are some corruption happening. They take money, manipulate the report. Even the same image with the police, they do some manipulation and like that. But as far as I have been in AIIMS for 24 years in Delhi, and in Delhi and pertaining to my institute, I have seen we have never experienced any corruption, any manipulation. I repeat this. We have never experienced corruption, manipulation, and the court and the police is witness to it. But there are some sometimes at the state, there might be some medical officers, they are not forensic doctors, because any MBBS doctor can do medical work. So many of the MBBS doctors, they are not oriented to the medical work because of the very less exposure during the MBBS. And many times they end up being mistake. And many times they end up, not doing justice to their report. Out of ignorance, many times I've seen, because many times we get cases referred to us from the state medical legal case, and finally we find that it was a minor error because of ignorance. And we have always corrected them, and the authority also have accepted it. So there are some mistakes by the medical officer in the state in the states because of ignorance. So, but of course, corruption is prevalent everywhere. I don't say that they are 100% corruption free. But doing corruption in the field of justice is really a very horrible crime. It will be a horrible mistake.
Yes, Doctor. Thank you so much. I think these are all the doubts which any person will have when the moment they hear the word forensic medicine. This is the thought which comes because the media and the newspapers, sometimes they project wrongly also because they suspect the genuinity of the reports, and this is a human nature to suspect the reports, So all the more it is important how we need to be careful, because we have to answer these suspicious human minds. So that again gives us the forecasting how careful we should be in collecting the evidence, preserving the evidence, and forwarding the evidence on time. Yes. Thank you, Doctor. Thank you so much. I think, yes. And Dr. Rati Balachandran has joined us. Madam has another urgent meeting. So, Surbala, over to you. You can invite Madam to address the participants, and it is full. 1,000 participants have enrolled. Now they will be joining on YouTube link because we can accommodate only 1,000. Thank you so much, participants. Really, it is a very highly encouraging response, and it shows how much everyone is wanting to know about forensic nursing. And over to Supala for the inaugural session. Yeah. Thank you.
Moving forward, it's time to begin with our formal inauguration program. For this, I would like to welcome Dr. Randeep Guleria sir in his absentia, Director AIIMS, New Delhi, Dr. Rati Balachandran ma'am, ADG Nursing, Ministry of Health and Family Welfare, Dr. Sudhir K. Gupta sir, Professor and Head, Department of Forensic Medicine and Toxicology, AIIMS, New Delhi, Dr. Lata Venkateshan ma'am, Professor cum Principal, College of Nursing, AIIMS, New Delhi, all the speakers and all the participants, all the faculty members from across the country and from other country also. Now to begin with the inaugural session, I would like to call Madam Dr. Rati Balachandran, ADG Nursing Division, Director General of Health Sciences, Ministry of Health and Family Welfare. Ma'am is always there to support in all the nursing related endeavors, especially for upliftment the profession and empowering the nursing professionals in many ways. So I would request Madam to address the participants. Over to you, ma'am. Once again, I request Madam Dr. Rati Balachandran ma'am to address the gathering, ma'am.
Shweta, Dr. Rati has joined.
Yes, ma'am. She has joined. Calling. Ma'am went for our urgent meeting. Ma'am, she has called. She has been called. So, ma'am, we can move for.
Yes.
Then moving forward, we'd like to invite our director, sir, Dr. Randeep Guleria, sir. Sir is not able to join with us presently for this program, but sir has sent us the message through the video. So I would request Ms. Shweta to play the video message from the sir for all of us.
Good morning. At the onset, let me congratulate the College of Nursing for this program, which is basically a faculty development program, and it has originated from the fact that forensic nursing has now been introduced in the new BSc nursing syllabus as a course as far as per the Indian Nursing Council. Now, a large number of faculty, I would say probably almost all faculty, during their training did not have this course as a part of the training program. And therefore, this is a new course, which I think is very, very important. At the same time, I'm also grateful to the Department of Forensic Medicine and Toxicology for supporting this movement and coming forward to train the faculty in the College of Nursing across the country as far as forensic nursing is concerned. The Department of Forensic Medicine and Toxicology has been there since the inception of the All Institute of Medical Sciences and have been doing excellent work as far as teaching, training, and research is concerned, along with their usual medical legal activities. I am also aware that faculty from the International Association of Forensic Nursing will also be contributing in this endeavor. The reason why I feel this is very important is because with changing times, new challenges have been put forward as far as the nursing fraternity is concerned. We all are talking of various subspecialties in the nursing area, which includes nurse practitioners, nurses in the ICU, And as a part of that, forensic nursing is also something that is very, very important. They are not there to replace the forensic physicians, but to complement what they're doing. And often we have patients who come even in the emergency who may have features of child abuse, may have been victims of domestic violence, we may have issues of crime against the elderly, or we may have issues of accidents, self-inflicted injuries. All of these come to the emergency or sometimes are seen initially by the nursing fraternity. And it's very important that the nursing fraternity therefore knows how to manage these patients from the legal point of view, how to be able to do things properly, and what are the issues that need to be kept in mind. There is also the issue of the sexual assault forensic examination, the one-stop center, which is there as per the government guidelines. How does that function? What are the responsibilities and the layout? So I think this is very, very important, and also a little bit of idea of the Indian judicial system as to how does that function, so that the nursing training people in this area, that is the forensic nurses, are properly trained. My own feeling is that as we move forward, it's important that we develop teaching modules in this area, which can be then made into a group of webinars, both in terms of the lectures, but also some degree of videos. And then this can be disseminated across the country as training program for the forensic nursing program. What I can see from the program is that you have a very good program which has been introduced, which has a lot of important topics like violence against children, the POSCO Act, and then of course issues of forensic examination and accused in sexual offences. I think this will be a great training program, and I wish the organizers the very best. I'd like to congratulate them also, and I'd also like to congratulate Dr. Sudhir Gupta, Professor and Head of Forensic Medicine, and Dr. Lata Venkateshan, the Principal cum Professor of the College of Nursing. My very best to all the delegates who have joined in for this program.
Just 2 minutes,
Thank you very much.
What is this?
Just 2 minutes.
Our director, Dr. Randeep Guleria sir, for this beautiful and very concerned message toward starting the forensic nursing in the country and taking the initiative by the College of Nursing in the AIIMS New Delhi. Thank you, sir, once again. And now I would like to request, so before that, Sweta, is the ma'am still there, or should we continue with the Dr. Sudhir sirs?
Ma'am has joined
Okay.
and she will address that.
Okay. Now I would like to request our esteemed guest of the Faculty Development Program, Dr. Rati Balachandran, ma'am, the ADZ from the Nursing Division from the Director General of Health Sciences and the Ministry of Health and Family Welfare. As I have already said, ma'am is always there to support in all the nursing related endeavors, for especially the upliftment of this nursing professions and empowering the nursing personals in many ways. So now I would request you to deliver the to deliver your speech for this participants, ma'am. Over to you, ma'am.
Am I audible? Yes, ma'am. First of all, warm greetings from Government of India to the organizers and the guests and the Dr. Sudhir, Department of Forensic Medicine, AIIMS, Delhi, for sparing your valuable time and extending support in training nursing faculties in the forensic nursing. As we all know that the curriculum of BSc Nursing has revised, in which the forensic nursing is the topic to be covered, and there is a gap in the knowledge which was not earlier covered in the curriculum. So the faculty preparation is the very important part for that. And I appreciate and congratulate Dr. Lata Venkateshan to taking this initiative and bringing the expertise from forensic department for the benefit of nursing faculty across the country. And also thank the Department of Forensic Medicine AIIMS for extending your support by having the resource persons for the 2 days, 3-day long training program virtually. And I also appreciate Eco India for supporting us in this so that we can bridge this gap and empower the nursing faculty to deal with the subject and teach the students with the latest advancements and the importance of forensic knowledge in dealing in their day-to-day activities. Nurses being the custodian of patients and being available with the 24/7 near the patients, and they are the persons to bring the evidences so that the justice will be there for the victim, and also which will contribute to the scientific investigation of the situation. So nurses have a great role for that. So by empowering the faculties, we are ultimately planning to have equipped or knowledgeable nurses who will be able to cater needs in various departments, be it in the hospital or in the community, for the safety and protection of people in our country. So with these words, I extend greetings from Government of India and also appreciate the participants for sparing your valuable time, and together we will be able to bring changes and make more and more empowered nurses to take lead and deliver their services for the benefit of the community. Once again, I congratulate the organizers and wish the participants a great learning time. Thank you very much for having me among you.
Thank you so much, ma'am. We know that you have a very tight schedule, but still you are here with us to deliver the speech, interact with our participant. And I would like to really congratulate and for this upcoming faculty development program. With your support, we could do this, ma'am. And thank you so much once again, ma'am.
Thank you. I may be permitted to leave as we have another meeting planned.
Lata ma'am.
Thank you, Rati madam. Thank you, Rati madam. I think there is overwhelming response. 1,000 participants have joined and around 400 are in waiting room. We have shared the YouTube link. Hope they are attending in YouTube. So this shows the need for the program, and probably we may have to repeat the program in future so that more participants will be getting benefited.
Yes, ma'am. We can have a better, larger platform so that more and more people can come together and also interact, because being a new topic, it would be nice if we can clarify their doubts.
Yes. So we will also invite forensic nurses, those who are working in forensic departments, to share personally how they are contributing in the field. That will also make the sessions very interactive and interesting in future. Thank you.
Thank you, ma'am. Thank you once again.
Thank you so much, ma'am. Next, I would like to request Dr. Sudhir K. Gupta, sir, Professor, Head of the Department of Forensic Medicine and Toxicology, AIIMS New Delhi, who agreed to be a part of the faculty development program with his team. Sir has contributed in institutions and the society tremendously with his expert and experience in many cases. I would like to request the sir to address the participants, but sir will not be joining with us in personally, but because of some emergency meeting. On his behalf, I would like to request Dr. Abhishek Yadav, additional professor from the Department of Forensic Medicine and Toxicology, AIIMS New Delhi, to deliver the introductory speech. Over to you, sir.
Good morning, ma'am. Am I audible?
Yeah, yes, sir.
So, ma'am, actually, just like I told you, HOD sir is traveling on some confidential government assignment. So we could not even pre-record his message also, but he has sent us a written message so that I can read it on his behalf. So, ma'am, first, HOD sir wholeheartedly congratulate the College of Nursing, AIIMS New Delhi, for proactively taking this collaboration with Department of Forensic Medicine, AIIMS New Delhi, for the sensitization and awareness of the forensic aspects of nursing practice. And sir also wants to appreciate the efforts of our principal madam, Dr. Lata, for making this program not even say possible, a huge success in such a short amount of time. So regarding forensics, in the understanding of layman, generally the word forensic comes, everybody thinks that it deals with the dead. But forensic is not only about the dead people, but it is about the application of medical knowledge in our day-to-day life to the administration of justice and maintaining the law and order, and particularly in the helping the victims to get the justice for the violent act done to them. So similarly, forensic nursing is the application of nursing knowledge in the administration of law and justice, just like medical profession, MBBS or MD, etc. And again, to detail it, forensic nursing is just like Dr. Milo told, is an essential specialty which has been part of medical legal practice from ages. Nursing professionals have been doing their role in emergencies, in casualties, in wards, in ICUs, you can think coordination with the doctor, but their contribution is still unrecognized in our country. And the forensic nursing is an important aspect in the medical profession practice, which not only needs to be introduced and promoted in our country, but also needs to be, you can say, incorporated by the methods of legal legislation, so that their evidence and reports and, you can say, signatures can also be recognized by the courts of law. And this will dramatically improve the quality of forensic service in the hospital, like some of our participants raised the issue regarding the corruption. So if the work will be divided in the layer by layer, it will not only alleviate the doubts regarding the medical legal practice, but will also ensure the transparency and credibility to the forensic examination. Then forensic nurses provide specialized care for the patients who are experiencing acute and long-term health consequences associated with the victimization or violence. They have an extremely important role in the identification, examination, management in a variety of medical legal cases, and particularly sexual assault, domestic violence, child abuse and neglect, elderly mistreatment, death investigation, correctional homes, and not least but in mass disasters. So these are few, I mentioned very few of the cases in which the patient gives more information to the nursing professional. They are more comfortable with them than to the treating doctors. So in identifying particularly child abuse, sexual abuse, minor abuse, the role of nursing professional is too much important in our system. And again, forensic nursing is not separate and distinct from other forms of medical care, or you can say medical legal practice, but rather integrated into the overall care and needs of the individual patient. Now then, if we go in the further subdivision, we could go into clinical forensic nursing, clinical forensic medicine nursing, then regarding the evidence preservation which are collected in the wards and ICU and then sexual assault forensic nurse examiner is a very well recognized concept and practice in Western countries. In fact, HOD sir and me also have been to Europe and US. So they are having a very good, you can say, network and expertise and recognition of forensic nursing. Then in mental health act also the role of you can say nursing professional is very important. Then to conclude and not to delay the academic session, we once again wish extend our best wishes to the program. And again, sir is very much highly impressed by the number and enthusiasm of participants which has crossed 1,000. We were not anticipating this huge response. And all the best for the academic session and academic field for the next 2 days. Thank you.
Okay, thank you so much, sir, for your encouraging and a supportive words. And we are looking forward to collaborate with you and your team in the future endeavor. Thank you so much. And I would like to thank Dr. Abhishek for delivering the message of the Dr. Sudhir. Thank you so much. Now I'd like to call Dr. Lata Venkatesan, Professor cum Principal, College of Nursing, to deliver the vote of thanks as we come to the end of this inaugural program. Over to you, ma'am.
Sorry. Thank you very much, Subala. At the outset, I sincerely thank God Almighty first for giving us the opportunity to host the program. It is possible because we are part of AIIMS New Delhi and with the support of Department of Forensic Medicine. Otherwise, this subject is totally not known to us, and we may not have had the expertise to host the program. So I am thankful to Department of Forensic Medicine, especially the head of the department, Dr. Sudhir Gupta. When I approached, he immediately accepted and he gave the nod. We will host the program, and he delegated Dr. Abhishek Yadav and Dr. Kulbhushan Prasad to help us. And very quickly, less than a week's time, we have designed the program and they have agreed. And we wanted the program to be benefited by all the faculty members working across the country. Because we know all the other colleges of nursing have got limited resources to host forensic nursing program, because this department is available only in government institutions, especially the institutions which are having medical colleges. So we took the opportunity of empowering all the faculty with the knowledge of forensic nursing. So thank you very much to the head of the Department of Forensic Medicine and the faculty members who volunteered willingly to handle the sessions and handhold us in future also to take up forensic nursing in a great way in our country. And our director, Dr. Randeep Guleria, always supports any activity organized by College of Nursing. And whenever we organize an internal program, he motivates. We are an institution of national importance, and it is the responsibility of us in the building of nation. And he always says, please escalate and expand the program for the benefit of the entire nursing fraternity in the country. So every time, whatever initiative we start with, he envisions that the entire country gets benefited out of it. So that is the motivation for us to host national level webinars and national level programs. And of course, all these programs are supported by Ministry of Health and Family Welfare. We have Dr. Rati Balachandran, the Assistant Director of Nursing, who is there supporting all the activities. And ECHO is there because technically we need support to host huge audience. So ECHO is playing a vital role in preparing nurses with their case-based learning approach and having telemedicine and tele-nursing clinics. It is not for helping patients, but for sharing best practices. ECHO is bringing in innovative methods of learning and helping the patient community. So that way we are also very happy to get associated with the ECHO team. And so combined effort of nursing division, ECHO, Department of Forensic Medicine and College of Nursing has brought this 2 days of learning program into reality. The program is successful only by the participation of the audience. Otherwise, all the efforts would have gone futile. So we are really encouraged to see complete occupancy of the program. And there are around 300, 400 participants waiting in the waiting room. We are not able to admit them. Please tell your colleagues to attend in the YouTube. The YouTube link is shared. Post in the WhatsApp groups and other social media. So those who want, they can attend in the YouTube. This is streamed by AIIMS Telemedicine channel in YouTube. Anytime you want, you can again listen to the sessions, and you can make your undergraduate and postgraduate students to listen to the speakers. That is the advantage of having getting connected to YouTube, and ECHO has got recorded version as well. We will look forward your feedback, support us, so that we will repeat such programs in future. And we will also look for advanced forensic nursing roles, because there are a lot of technology which is helping forensic medicine to expand significantly. So we will look forward in future for more such courses in the field of forensic nursing. Thank you all very much, and I must thank Subbala, who is moderating the program, the Associate Professor in Psychiatric Nursing from College of Nursing. And I must also thank Mr. Susan, our technical person from set facility of AIIMS, who is helping us in YouTube streaming. And the entire program, right from designing until the execution of this day, it was supported by Ms. Sweta Pathak from ECO team. Sweta, thank you. And we also thank your IT team in the background who is telecasting it. And also whoever has been behind the screen in executing this program, my personal thanks to each and every one. Thank you so much.
Thank you so much, ma'am. With this, we come to the end of the formal inauguration program. Without wasting much time, we would like to move on to our next session. As our speaker is available next to me, I would like to introduce our next speaker, Dr. Swati Tyagi. She is presently working as a senior medical officer in the Department of Forensic Medicine and Toxicology, AIIMS, New Delhi. Dr. Swati has completed her MD from Government Medical College, Amritsar, Punjab. Her area of expertise is medical legal expert, conducting more than 4,000 medical legal reports and more than 2,500 postmortem, including all the varieties, expert witness in the court of law, sexual assault, survival medical legal examination expert, and she is also a gold medalist, highest marks in the first professional MBBS course, and silver medalist in the two subjects, that is anatomy and biochemistry. And she has been an invited speaker in the many forums. She has undergone many training programs, and she has published 12 articles, out of which 5 articles are in the Index Journal. And she is also a lifetime member of Indian Academy of Forensic Medicine. And now I would request Dr. Swati Tyagi to start the session on sexual assault, forensic examination, one-stop center, layout, organization, and function. Over to you, Dr. Swati.
First of all, thank you so much. Am I audible? Am I audible?
Yes, ma'am. Yes, ma'am.
Thank you so much. Thank you so much. So first of all, good morning, everyone. Myself, Dr. Swati, and I'm here to present sexual assault forensic examination, one-stop center, layout, organization, and function. So start with the introduction. Sexual assault is the most heinous crime against the dignity and modesty of the women and children, which does not involve only the body, but also causes injury to mind and soul. Another word comes is gender-based violence. It is a global health, human right, and development issue that affect every community and country in every corner of the world. It's a very rising issue, and right now it's a very important part which is to be discussed here on this platform. In India, we have a variety of gender-based violence manifestations. In India, you can say it's rape, honor killing, acid attack, witch hunting, sexual harassments, child sexual abuse, trafficking for commercial sexual exploitation, child marriage, sex selective abortion, sati, and violence due to inequities in social life, displacement, and common instance. There are a long list. I just mentioned few. So I think everyone is aware about the Nirbhaya incident that has been taken and that has been occurred in 2012, and it's generally shocked the whole nation and led to the change a lot of things after that. After that incident, Justice Verma Committee was constituted and given us a guideline to have one-stop sexual assault examination care and research center. Based on their recommendation, the criminal law amendments were there in 2013 and POSCO Act 2012 relating to child sexual abuse, exploitation. So as we know, in these acts clearly have laid down the necessary guidelines for the medical care and medical evidence collection from the survivors of sexual offences, and these guidelines also outlines the role of medical professional involving the procedure of establishment of one-stop center crisis in sexual assault cases. So let's come and discuss some of the problems which are being usually faced by the survivors in the current scenario. First of all, survivors already in distress, recounting of the history multiple times, as already in previous presentations, our seniors have mentioned that a history is taken by first of all by the person in the emergency, then the gynecologist, then a psychiatrist. A lot of people take the history one by one. It's a harassment to the sexual assault survivor. Next comes to they has to run between departments in different locations to do the needful things. This is a problem that has to be sorted out. Next is feeling of fear and shame from the medical personnel as well as police. They need a privacy, support, medical aid, legal aid, etc. All these things should be present at one place for their help. And last one is delay in the services. So how we can solve these problems or take initiative to solve these problems? Here comes the one-stop center. Let's discuss what the government has given one-stop center. It is also known as Sakhi. In Hindi, it means as friend of that person, to talk with that person as a friend, to listen to her problem and to help her as a friend. So its name is given as Sakhi. It has been implemented since 1st April 2015. One Stop Center is centrally sponsored scheme of Ministry of Women and Child Development, Government of India, for addressing the problems of violence against the females. And it has been started all over the India in different phased manner. This scheme is being funded through the Nirbhaya Fund. Now, let's come to the objectives of One Stop Center. The major objectives are, first one is to provide an integrated support and assistance. Definitely, it is a must thing. It is provided to the women affected by the violence, both in private and the public space, under one roof. Second objective is to facilitate immediate, emergency and non-emergency access to the range of services, including medical, legal, psychological and counseling support under one roof to fight against the violence against women. Now, let's take a look over what One Stop Center scheme gave, or what One Stop Center services we have. That is social counseling, medical support, legal support, emergency response and rescue, assistance for women to lodge an FIR, a shelter, a video conferencing for any summons in the court. So all these facilities are to be required by a female. So that facilities are to be provided at one area under one roof, for which One Stop Center is created. Now, our department has proposed to the Ministry of Women and Child Development, Government of India, for the establishment of a national one-stop sexual assault examination, care and research center at AIIMS, New Delhi, with utmost advancements. So let's take a look what we had. Department of Forensic Medicine and Toxicology, AIIMS, New Delhi, has a pivotal role in examination and evidence collection, documentation and treatment of female and child survivors of the sexual assault, along with the examination and evidence collection from the accused males committing the crimes. We are dealing with both accused and the victims. Now, presently, the department is already catering the south and southeast districts of New Delhi. So, what is the vision and mission of this agenda? The first is to cater to all the sexual assault victims of Delhi and NCR, as well as any referred case from the pan-India. Second one, the National Stop Center will be dedicated to care and protection of sexual assault and crimes against women and children, and further research on holistic redress of sexual assault survivor. This word holistic is very important in this scenario. And it will be the India's first nodal national center to provide the speedy evidence proceeding and criminal identification information to police. It will be one of the most advanced window center to provide medical examination, evidence collection, DNA profiling, post-trauma care, research and training, all under one roof. It will be act as a national center for training of doctors and the healthcare workers that are involved in the cases and research. And it will also mentor for the establishment of basic infrastructures of similar centers at other district level. Now, what is the need of it? First of all, maintaining the dignity and the privacy of survivors. This is a very utmost important thing, which is usually we fail to address. As we all know, in emergency, it is already an overcrowded area, and the doctors there are more concerned about the treatment of the patient, for the life of the patient. And you can say they are not well trained about the medical legal examination. So, dignity and privacy are somewhere we lost that thing. So, as we know, overcrowded emergencies departments' top priority is patient's life. Medical personnel, they are not specifically trained for medical legal examination and trace evidence collection. This proposed center, which we have given, has a dedicated medical personnel, including doctors, trained forensic nurses, paramedical staff, specially trained to cater the survivors of sexual assault. And the center also have advanced set of instruments that are required for all the evidence collection and documentation. The important thing about the center is there will be a constructive relationship. As I already mentioned, all under one roof. So we have a constructive relationships with other department, gynecology, surgery, so that they can treat the patient in a one place. And also the police come to that place for the investigation of the crime. So all things they have occur at one place. This will help the patient not to roam here and there for everything. Second thing is networking. Networking is also very important because even after sexual assault, they required homes to help the normal publics, the normal service providers will help them in giving them comprehensive cares. Thus, the holistic examination report along with the result of analysis of scientific evidences will be available to the investigating agency in a prompt and prioritized manner. And finally, the research data which will we get that can be analyzed and help in the research and development of these areas. Main objectives of this center will be medical legal examination, evidence collection, basic laboratory investigation, in-house DNA testing, holistic medical care, psychological counseling, psychiatric treatment, testing up for the sexually transmitted disease and pregnancy, nationwide training programs for medical personnel, and definitely act as a mentor center for establishment of similar setups in the state level. Now, as you can see, this is an umbrella and definitely we have all these features below this umbrella which contains emergency response and rescue services, assistance, psychological support, assisting in lodging a FIR, all this under one umbrella. This is called what we call as holistic approach. For establishing the center, what definitely areas we require? First of all, a reception area. A reception area definitely a must of the thing. A forensic nurse should be located to that place to deal with the patient initially because females are more comfortable with them. Second one is medical legal examination room in which we can examine the patient thoroughly. Then there will be medical examination evidence collection room. In proposed center, medical examination of the victim will be drawn complete privacy. That is the main target of our. And it will be fully functional and equipped room. Now, next will be counseling room. Video conferencing room for any evidences they can be done from that area only to the court. Then short shelters will be provided if patient want to stay for 1-2 days, she can. Then laboratory should be there and fully automatic high thorough output DNA laboratory should be there. Pantry and washroom, other facilities should also be there. Now, next important thing comes out to be evidence collection. Trace evidence collection with an ultra modern equipment. That is, we have advanced light sources, special technologies which we will use to enhance the images of identification of injuries like faint bite marks and identifying stains, other biological fluid that are otherwise not visible through naked eyes, because usually we examine the patient with naked eyes and generally we miss the findings which are very faint. So we will provide it with high technology so that none of the finding will be get missed. Second comes to be standardize the safe kit for the evidence collection. Safe kit is being designated, contains all the instruments which are required for the evidence collection. We don't have to run here and there. We have that safe kit. It means we have everything to collect the evidence. And this safe kit which will be utilized for the DNA evidence collection so that it not be degraded and kept for years till the justice is revealed. Next one is fully automatic high DNA laboratory. The latest and advanced technologies at this center will be equipped and can generate up to 400 DNA profiles from a mixed evidence sample, highly degraded sample or low quality of sample. Now this center, the most important thing about this center is that we have our own advanced DNA profiling setup. There shall be no need to send the DNA evidence samples to outside agencies or the departments, thereby providing a complete DNA profile of the victim and the criminal in a very short duration. It will be the cornerstone in establishing the scientific-based sexual assault investigations. Now, here comes what is the role of forensic nursing in that? Forensic nurses, specially trained to be empathetic management of the traumatized survivors of the sexual assault. They will assist in counseling, consent taking, examination of the survivor, along with the scientific evidence collection, their storage, refrigeration, and proper documentation of the evidences. They will work shift, provide 24-hour services at the one-stop center. She will provide the first aid and immediate life-saving medical assistance to the aggrieved woman until she reaches to the hospital and accompany her. So in case a woman is affected by sexual violence, she will make sure there should be a strict compliance of the protocol given by Ministry of Health Welfare and conduct the forensic examination along with the forensic doctor. Apart from that, she should be very careful about, because she is going to examine first and patient will be more comfortable with her. So she should notice any physical injuries, any pregnancy, sexually transmitted disease, HIV and hepatitis B. Because exposure to sexual violence is associated with a range of consequences apart from that. Now, what are the steps for the initial handholding of a woman coming to one-stop center? These are very basic things, but usually we forget that things. So I'm just here to remind that these things should be done with the sexual assault survivors. First of all, you have to greet them by their name. Use their name to address the person. Second, make her your central focus so that she feel like, yeah, somebody is giving me importance, somebody is listening to me. Third point, introduce yourself to the survivor and tell that what are your role toward that patient. Offer her water, put the patient at ease. Because if the patient at ease, then only she can give the brief history about the incidents, because patient is already in so much of trauma that she will not able to speak unless and until the patient is at ease. Aim for an attitude of respect, professionalism within the boundaries of your survivor's culture. Have a calm behavior, because a frightened survivor will not able to give any history, will not be relaxed, will not help herself. So we have to calm him first. Be not in hurry, just give the patient time to be relaxed. Second, make eye contact, be empathetic, don't be judgmental to that patient. Aim to limit the number of caregivers. Most important thing is one-on-one care is the best for the sexual assault cases. And I've previously mentioned a lot of people talking to the same patient, the same history again and again is not good for that one. So ask the survivor if she wants a specific person to be her side, please call. And ask the survivor if he or she has any question, any doubts, just try to solve the questions, try to solve the doubts. That is the most important thing. So with this note, my take-home message is this one-stop center is a coordinated, multidisciplinary approach in conducting the examination with access to comprehensive, immediate care, and will definitely help in minimizing the trauma to the survivor. So with this note, I will take leave. Thank you so much for patiently listening to me. Over to you, ma'am.
Yeah, thank you so much, Dr. Swati Tyagi, for taking all of us and for walking through that all the one-stop center. What does it mean and how this center is going to work? And if it is coming up in AIIMS New Delhi, that will be beneficial to the many of the people who will be coming to the AIIMS. So thank you once again, Dr. Swati. Lata ma'am?
Supala, I think we are well ahead of time. So, Dr. Swati, will you be able to take a few questions and interact with the participants? Because previous session also there were many questions which were posted. The participants are welcome to interact with Dr. Swati. You can unmute yourself and speak, or you can post your questions in the chat box. Questions?
Hello, ma'am.
Yes, please.
Good morning, ma'am. Actually, ma'am, my doubt is who is supposed to collect the evidence that we are getting a sexual assault victim? Like it's a nurse's role or the option that is often made available or to collect that evidence.
Should I answer? Hello?
Dr. Swati.
Yes.
Yes.
First of all, thanks.
He's asking who should collect evidence.
Thank you so much for the question. It's a really nice question, first of all, an important one. This sample has to be collected because it's a medical legal case and medical legal sample. So it's definitely to be collected by the forensic expert, and forensic nursing should always be assisting that scenario of collecting the evidences. So knowledge of the forensic evidences to be collected is very important for them also, because sometimes, hello? Hello? Yeah. So I was saying this forensic sample collection is definitely by a forensic expert because they have the complete medical legal knowledge regarding this, and definitely forensic nursing will be very grateful to assist this process of handling of collecting the samples. So gynecologists, they are not that I will say they don't have that much knowledge to collect the samples at the appropriate quantity, in what sample to be preserved. So this is very important. How much sample has to be collected, where is to be preserved, how it is to be done. So these questions can a forensic expert can better handle. So it should be collected by them.
And there is a question who is managing this one-stop center, and is it available in every state? There are two questions related to one-stop solution center.
Right now, all over India, it's around 234 one-stop centers are there, and in Delhi only we have 11 stop centers. But what we are designing, what we have proposed, it's somewhat little different and more advanced version we are proposing to ministry. So what we get, the better technologies we can get over here. Right now we have, but we will have more advanced version of that thing with more advanced DNA technologies and sample interpretation things. So yeah, right now we have one-stop centers all over India and Delhi also, but we want a more advanced version of it.
And who is managing it? Who are all working in this one-stop center? Any organogram you can explain? Who are all the professionals involved?
Right now, it's a completely central agency. It is centrally sponsored scheme completely. So in AIIMS, it is. I think it's under the hospital only.
Yes. Yes. And there are more questions. 1 minute. Shweta, can you read any more questions from the chat box? What is it allowed to take photographic evidence when sexually assaulted victims come to us?
As it is a medical legal case, we collect. Hello. Hello.
Can I request the participants to mute their mics? Yes, Dr. Swati, you can continue.
Yeah, we collect the evidences for the medical legal purposes. So we can take the photographs, but that is for the court purpose only. That should not be taken in personal mobile, so that should not be like publicized. It is a completely legal matter, so photographs should be kept in sorted out portions. They don't have to be like mingle with other photographs. So basically, not to take with the personal cameras. If taken, they have to be kept at separate place so that it not accessible to the other people, because it's a legal thing, so that should be maintained.
Yes. And another question, forensic nurses, are they entitled to give evidence in the court?
This is a question right now. I'm not in the position to answer this question. Maybe my seniors can be in the position to answer this question.
Yeah. So who is here? Dr. Abhishek is here. Dr. Abhishek or Dr. Tabin? Okay, we will question answer.
I got information from sir.
Yes.
That if the forensic nurses are signatory to that report, then they will give the evidence in the court.
Yes.
Yeah.
Yes. Okay. And somebody has asked, can you brief us about the extent of injury in sexual assault?
Sexual assault, as far as I have seen the cases, I have seen the cases from a scratch up to like a big laceration over that area up to the intestine. So extent can't be said, because I have seen from the basic scratch to the female up to a female which has been assaulted so much, like you can't even imagine.
Yes. Okay. And somebody is asking, can a nurse be qualified purely for forensic field, or is it an integrated role, or only forensic nursing can they practice?
I can answer it.
Yeah, they can.
Yes, yes. And another from Nancy, she is asking, could you explain how the victims are referred to one-stop centers?
Victims are referred, victims can be come by themselves, should be brought by any person or any NGO. Means there are no referral. They can come by self also. If they are being survivors, they can come to the hospital by themselves. They are to be brought by their friends, relatives, any unknown person, any NGOs. There is no basic step behind it. Ki some specific person should refer that person to the one-stop center. Anyone can brought that female, that survivor to the one-stop center. Anyone.
Yes, yes. And there is another question, are cameras provided for the department use, and any training is given with regard to how to collect the photographic evidences?
Yeah, there is a forensic photography, complete different aspect we have to learn. So yeah, there is forensic photography aspects better to learn before collecting the evidences and before going into deep.
Yes. And Anita is asking, what is the scope of forensic nursing in India?
Right now, as previously lectures are taken, so it has been observed that there is a lot of scope of forensic nursing in the future. As our seniors and ma'am already have said, our director, our HOD sir, everyone has said that yeah, according to them, it's a very good scope for the future for all the forensic nurses.
Yes. And there is yet another interesting question. Many times sexual assault is considered as an issue of females. In case men are assaulted, what will be the procedure for care?
As I told, it's a sexual assault survivors. I think if men are also sexually assaulted, they can also come, because problem is the assault and the problem person is a survivor. So even if it's male survivor, they can come to the center. That is a sexual assault survivor center, not specifically for the females who are saying only female center is there. It is a one-stop center, sexual assault survival center. So if sexual assault is happened to a male, they can also come over there. Definitely.
Yeah. And Mr. Rajesh is asking, how much significant of nurse's role in the court of law in case of rape or unnatural death?
As I've already mentioned, whatever in court of law, whatever documents you are signed, whatever things you have signed, you are signatory to that, you are responsible for that particular document in the court of law. If you are signing any evidence thing, if you are signing any evidence collection, you are definitely responsible for that report you are signing.
And Jyoti is asking, who should hand over the evidences to police? Whose responsibility it is?
This is the responsibility of the forensics expert, under which guidance the sample is to be collected, the report is to be made, the final report has to be handed over by him only to the investigating officer.
Yeah. Yes. Do nurses work in one-stop center now, and what is the basic requirements to apply to work in one-stop center?
Right now, forensic nurses as such is not a term in India. As far as I know about all these things, specific forensic nurse term is not being used in India. So they work as similar condition as you seeing in medical hospitals. They work, doctors and nurses are working in the similar forum on the one-stop centers. The forensic doctors and the forensic nurses will work.
Yeah. So nurses are working. They are not forensic nurses, but they are nurses who are doing the forensic job, forensic work. Yes. So, and Prabhujot is asking, is there any need for the presence of an additional person officially while collecting history from the victims?
The most important thing about this, while you're collecting history with the patient, as I already mentioned, patient should be very calm. If patient is calm with that, with the presence of another person, it's okay. If patient is okay with that, otherwise, like, no external person should be allowed with the female standing over there if female is not comfortable, because we have to make her very comfortable while examining, while taking history. So if she's comfortable, it's okay.
Yes. And if there is any emergency code, like we have 108 for medical services.
Right now, there is no specific code as far as my knowledge is concerned.
Yeah. Okay. And how many photographs should be required as evidence? Any limitation to have this many number of photographs?
Right now, there's no. Right now, okay, it is the documentary evidence. Photographs are the documentary evidences. So is not a limit. If you can, as many as photographs you can collect to prove that thing.
Yes. And Jannu is asking, MLC and forensic cases are same or equal, or is it different? And or it is
In forensic in itself means medical legal word. So MLC cases are definitely under forensic.
Yes. So all MLC cases are not forensic cases, but all forensic cases are MLC cases.
Yeah.
Is that correct? Yes.
Yeah.
Okay. So as of now, any special areas provided for nurses in one-stop centers?
Voice is breaking.
Sorry, ma'am, your voice is breaking. Can you repeat the question?
No, in one-stop centers, any training of the nurses happening now?
Right now, there is no such national-wide training, but yeah, on the lower basis might be there is a training, but not national-wide.
Yeah, maybe in the department part of their indexing program, orientation program, it may be.
Yeah, at the ground level, it may be possible, but not at the national-wide level.
Yes. What is the status of, where are these centers located? Is it in the hospital or outside the hospital, one-stop centers?
Basically, these centers are to be located in the centrally area, the area which is controlled by the centers. So basically, we have first go for the hospitals. If hospitals do not have the spaces for making this one-stop centers, so any other centrally designed building can be used for making this one-stop center, but it is centrally approved. So centrally designed area will be there.
Yes. And what is it? I think these are all the questions. Is second opinion from other one-stop centers is required as part of the evidence?
If the investigating agencies want a second opinion, it's completely their right. They can take second opinion.
Yeah. And is videography allowed while taking history for further use?
Videography, no. The videography is not allowed.
Okay. And what would be the legal issues faced by the forensic experts, if any?
Unless and until the report or the examination is done in a thoroughly manner, there is no problem with the forensic person.
Okay. And somebody is asking if there is any act for forensic medicine in India.
There are many rules and regulations, and that will be dealt in the further lecture. That's a separate lecture for that.
Yeah. Yes. We have the Indian judicial system.
Last session.
And rights of the victim, all those. There is a separate session for that. Yes.
Yeah.
I think these are all the major questions. I think the other questions are also of the same nature. Yeah. So thank you, dear participants, for engaging with very interesting questions. And it was really very nice time we had, because the sessions were managed in such a way we kept 15 minutes of buffer time in between the sessions. So we are able to answer the queries of the participants. Thank you, Dr. Swati, for answering all the doubts raised by the participants.
Thank you so much, ma'am. Thank you so much.
Thank you.
Thank you, Dr. Swati, once again for the elaborate and answering all the queries from the participant. Ma'am, shall we move on with the next speaker because sir is already there here along with us?
Yes, yes.
Yeah. So now I would like to call upon our next speaker, Dr. Abhishek Yadav, sir, presently working as an additional professor in the Department of Forensic Medicine and Toxicology in the AIIMS New Delhi. And sir has completed MBBS in 2003 and a PG in 2007. And sir has got already 17 years of teaching experience and work experience in the various medical colleges. And he is a recipient of European Council Accredited Service Certificate Training course in University of Zurich, Switzerland in virtual autopsy. And sir is a co-investigator and a chief coordinator for the Center of Advanced Research and Excellence in the virtual autopsy, a first of its kind in the SAARC countries. He has also conducted around 5,000 medico-legal autopsy till date, and the sir has got 102 publication in his credit, and the sir has attended more than many conferences, workshops, symposiums, and thus has been awarded the best faculty presentation in IAFM Forensic Medicon 2018 and 2020. And sir has been the resource faculty in the National Judicial Academy, CBI Academy, and the National Investigation Academy. So now I would request Dr. Abhishek to deliver the session on importance of forensic DNA in sexual offenses and other medical legal cases. Over to you, sir.
Thank you, madam. I think before starting my session, I might add to the few queries which were asked in the previous session. First was regarding the reporting and the legal evidence. So the thing is, the ultimately responsibility and accountability regarding the reporting and the handing over the sample, no doubt lies with the forensic expert, gynae doctor, whosoever doctor is finally signing the report. But a doctor needs a multiple level of assistance from his support staff, including nursing professionals. So if their name is mentioned in the report or if they have signed somewhere, generally court do not call the other people. Generally they call the doctors only who has finally signed the report, but his support staff can be called by the court of law or the investigating agency to give the witness or evidence regarding limited to their role only. They will not ask them any particular question regarding the opinion, etc. Second thing was about the responsibility of the sample handing over. Again, the final, you can say, as per the law or the legal provision, the responsibility lies with the doctor only. But in our setups in hospitals and in even many of you must be working in emergencies. So there are, you can say, in ward also, in emergencies also, there are registers, sample or evidence receiving registers. So that the procedure is generally done through that, you can say, after getting a proper receipt in the ward registers or emergency registers. So those registers are in the custody of the nursing professionals. Now again, regarding third, who runs the one-stop center? See, it depends upon center to center. Like in big hospitals, like in Safdarjung, AIIMS, RML, you can say a one-stop center is like managed and is in the custody of our nursing professionals only, just like in the normal wards. Just like in normal ward, OPD, there is a nursing superintendent in charge or in emergency. So that is under the, you can say, the basic administration is under the custody of the nursing professionals. But in the remote centers or in the peripheral centers where we are not having the hospital setup, there they can, depending upon the availability, ANM or whosoever, like NGOs can also run the basic administration and infrastructure and take care of the center. That depends upon the local, that mostly depend upon the local factors and the regional factors. So I think these were the few queries which I would like, I have added. So I think now we can go with our presentation. Can we start? How to?
Shweta, can you please share the sir's PPT?
Thank you, sir. I think it was very clear for the participants.
Shweta,
Yes, now over to your session, please.
Shweta, can you please share the search PPT?
Can you unmute?
Are we starting?
Shweta? Shweta, can you hear me? Shweta, will you please share the search PPT? There was me. Excuse me, Shweta, can you hear me?
Yes, ma'am.
Will you
Yes,
please
ma'am.
share the search PPT?
Sure, sure. Share it now. Sir, can you confirm I'm on the correct page, sir?
Yeah, you can start the slideshow. Now,
Sorry.
can I start?
Yes, sir. Over to you, sir. Thank you.
Okay, thank you. So why I've choose this particular topic? I might have chosen the examination of the victim also, because see, whatsoever everybody is shouting like justice for the survivor, justice to the sexual violence, justice to the victims of violence. And what our role is in the hospital setting is the collection of sample, is the documentation of injury. Now coming to the sampling part, okay, we collect the sample, we hand it over the police. But what is the importance? Why do we collect it? What's their role in the, you can say, ultimately to the prosecution of the accused, or you can say like confirming the guilt of the accused. So a very important part nowadays with the advent of modern technology is the assessment of DNA profiling from the samples we preserve. It might be a sexual assault survivor also, or sexual assault victim also after death, or it might be a murder victim also, it might be a live patient who has been subjected to violence. So ultimately, DNA is becoming an important tool for the conviction, for the prosecution, and sometimes for the exoneration of the innocent who are falsely accused in criminal cases. So I will just explain the brief outlook of the DNA profiling from the samples which we preserve in our hospital setting. So now coming to the DNA. Oh, okay. Now, so what is DNA? See, every cell in our body, our human body is consists of cells, then tissues. Tissue consists of organs. Organ makes living system. Then the basic structure is a cell in which there is a nucleus. In nucleus there is a chromosome, and that chromosome is made of a small unit called a DNA. So what is DNA? DNA is a, you might have been reading daily in the newspaper, DNA this, DNA that, DNA bill, DNA evidence. But what is DNA? DNA is a deoxyribonucleic acid, the full form. It is the strand of identity that living beings receive from their ancestors. Like I am having DNA of my father and mother. So what does DNA does in the forensic, or you can say criminal cases? So DNA determines hereditary, carries genetic instruction for growth, development, and function, which is responsible for various character of each person: hair color, eye color, body structure, functions. Sometimes your anger or anger issues might also be controlled by your DNA. So the structure of DNA was first described by James Watson and Francis Crick in 1953. Then, so what is coming to the DNA? So DNA is the basic genetic material in all human body cells. Every person inherits 50% of the genetic material from their mothers and 50% from their father. So every person has in this whole world, every person has a unique strand of DNA. So outside of identical twins, and those identical twins also monozygotic twins, which are from the same zygote and same ovum, only those can have the identical DNA. Otherwise, no two people can have the same DNA pattern in this world. So Coming to the introduction, because I told you DNA carries the vast information regarding disease and your psychological profile and all those stuff. So what's the use of DNA in forensic science? So coming to that, on September 10, 1984, Professor Alec Jeffreys and his team of genetic researchers at Leicester University produced what looked like nothing more than a murky barcode. Just like barcoding you might be seeing on the supermarket shelf or in the Amazon packet, the same. So they realized that this barcode can be used as an identification tool for living organisms, much like barcode identify the goods on our supermarket shelves. So the production of these barcodes were finally given the term as genetic fingerprinting. So, as per my knowledge and as per the medical literature which I have gone through, the first case where DNA was used, it was a case involving rape and murder of two 15-year-old girls in United Kingdom. First, one girl had been raped and murdered in 1983 in ancestral village of in United Kingdom. Her body was found undressed below the waist. Then again, after in 1986, not very far away, the body of another girl was found naked from the waist down. So DNA analysis, the semen was deducted during the examination of the girls, and DNA analysis present on the vaginal swabs from the two girls suggested that the same person had murdered them. I have just used a simple language. It means the DNA profiling from the both persons were the semen the semen detected were identical. Then in 1987, a man was arrested and charged with both the murders, but DNA profiling exonerated him, means they found him innocent. But the local police was convinced that the perpetrator is a local man. Then after taking the consent from the community members, they took blood samples from all the males of a certain suspected age group from 3 villages within the area. And finally, it led to the catching of the actual perpetrator who used to work in a bakery. So this was the first case where the DNA profiling was used. Now coming to the DNA profiling. So what Sir Jeffreys research team discovered like a barcode and given the term of genetic fingerprinting, it was further refined and improvised and improved upon and developed into the technique what we know as today as DNA profiling. DNA profiling is produced after the analysis of sample genetic material retrieved either from the individual or from a crime scene exhibit. Then further it involves the creation of a database of DNA of those who are convicted, jailed or suspected for a commission of a crime, so that in event of a crime in future, their DNA can be matched against the details in the database. So many Western countries are having it. In our country, we are still in, you can say, in a debatable stage, like DNA bill discussions are going on in the parliament from past 2-3 years. So it is just like the simple, like in the old times, police and in currently also police keeps a record of the fingerprint data of the known criminals. So what is the advantage over the conventional methods of evidence in our legal system? Like somebody raised the question in Dr. Milo's session, ki what about corruption? So a man can tell a lie, but science will never lie. So DNA is a totally scientific evidence. Until now, it is considered as a foolproof, not I must say foolproof, but a reliable source of evidence in the courts of law. So DNA is ubiquitous, like it is present in the all nucleated cells of body, where all, even your hand, wherever you are touching, you will leave some cells from your body, which will lead to the estimation of DNA. DNA makeup of a person is same in all the cells of the body and cannot be altered. My foot is also having the same DNA. My hand is also having the same DNA. My liver is also having the same DNA. My tongue is also having the same DNA. The saliva I excrete is also having the same DNA. And DNA of every person except in monozygotic twins is unique in its profile. Then again, like instead of some keratinized tissue, DNA can be extracted from all body fluids and from all tissues of the body. Then in postmortem cases where the person is not living, the DNA can be obtained from the body tissue. Then in cases where the body has been buried or sometimes body has been burned, DNA can still be obtained from the tissue. Then further continuing with the advantage, even in the burned and char remain, you might find some tissues or might find some bone marrow where DNA can be obtained. And so you from the teeth also, if the teeth are not burnt, from the pulp cavity, DNA can easily be extracted. Then again, DNA can be stored in very small quantities as compared to the other physical evidence. Like if you just go to the police khana, they are having huge storage of criminal cases from many years. They are crammed with the spaces. Our courtrooms are crammed with the spaces. For DNA, you just require a small laboratory freezer and the computer systems. And the data of the DNA profiling can be stored for a very long time. In fact, I think, say, if you have once analyzed the profile, it can be stored for as long as you want, till you do not want to delete it. Second, DNA does not combine. If 10 people are leaving their DNA in a crime, all the 10 DNAs will be deducted and analyzed, and their profile will be, you can say, generated from their individual book. So there is no chance of intermixing of DNA of one person to the another. So coming to the use of DNA in forensics, the foremost is identification, because in the conviction of a crime, the first question which investigator faces, who was the victim? So many times unknown bodies are found, unknown injured people are found. So identification is the foremost aspect. Then disputed paternity and disputed maternity. If you are working in the hospital setups, you might have encountered such cases frequently come, sometimes in baby mix-ups, and then in abductions, then inheritance, because wherever the human body is involved, a hospital will always be involved. So it's just like we think that abduction and inheritance are not our domain. Every crime where human body is involved is the domain pertaining to medical profession. Then rape and murder, these are very, you can say, well sensitized and very well highlighted aspect, and which we are unfortunately seeing in every day in newspapers, in media channels. Then another thing which some of you might not be aware is the disaster victim identification. Particularly, just like we are seeing the war is going in Ukraine and Russia. So right now, so everybody is involved in the military scale down. But there will be one, after few months, or you can say 1 or 2 years, there will be a stage where the relatives will be searching for their dead ones, or you can say their missing ones. I should not use the term dead ones, missing ones. And there are huge number of bodies are being recovered daily from one site to another site. So I'm not saying that they will achieve, but ultimately it gives an emotional closure to the families. Otherwise, we have seen many families who are searching for their missing people till they themselves die. Now, just to give an example regarding the, you can say, storage and the age of the DNA, it was recently published. So the scientists found a successful analysis of a 100-year-old seminal tail they were able to generate a complete DNA STR profile from a 100-year-old seminal stain. How? I will just explain to you. So they conducted investigation on a handkerchief containing seminal fluid suspectedly deposited 100 years earlier. The aim was to verify the possibility to achieve a complete genetic profile. And they were able to generate a complete male profile. And then consulting after historical sources and the history people and referring to the books, to the ancient books, it was found that the handkerchief was attributed to a famous Italian poet, and it was dated 1916. So the DNA profile found on the handkerchief was compared with the living male descendant, and the comparison of the YSTR. YSTR means the DNA which is particular to a male individual. Between both the profiles give positive result that the DNA which they have extracted belong to the same poet, and then confirming the reliability of the outcome. So these findings achieved by the current forensic methods empower the application of methodology, especially in past unresolved cases. I was just seeing a documentary, I think last week only, on Netflix regarding a New York torso murders. You can also search on your websites, or you might just go to the Netflix. So being a forensic person, it was very, you can say, interesting, and I would say very sometimes it's disheartening also that the accused who was caught for 2 murders and ultimately convicted for 5 more murders at the age at the you can say after 30 years of imprisonment, he revealed to a journalist that he has murdered more than 80, you can say, females, young girls, young male childs for the sexual assault crimes. And you can say he was just convicted for 5. So 75 families from past so many years did not have the closure and did not have the justice, because at that time DNA facility was not available and he was too caught based on the circumstantial evidence only, and police had a hard time to convict him for his crimes. So coming to the one aspect of disputed paternity and maternity. So just like I told you, the test is based on the principles of inheritance. A child gets one half his genetic makeup from mother, one half from the biological father. When the biological father or mother of the child is in doubt, currently DNA test is the most accurate form of paternity testing available. So for paternity testing, the sample will be from the father and the child, and for maternity testing, the sample will be for the mother and the child. So just to brought to the notice of the audience that I am particularly not going too much into the details of the, you can say, what happens after the sample collection in the laboratory, because that is a very extreme detailed procedure and it will again takes more than 1 to 2 hours to explain that procedure. Now just I including a figurative description. So on the left side we can say mother's DNA profile, child, then on the middle child DNA profile and the alleged father DNA profile. So in the first case, we can see the child is having DNA from his the mother also and alleged father also. So both the father is the confirmed parent, biological, you can say father of the child. And now coming to the second case, the just case below. So mother is the mother of child, that is for sure, but the father profile is not matching with the child. So the paternity, biological paternity of the father is ruled out in this case. So the case in which I was involved 2 3 years back, there was a very highlighted case. You must have read in the media also. A girl named so then finally named Geeta, because she was a deaf and mute girl. Though she was the girl named Geeta was brought from Pakistan, and our late honorable External Affair Minister Mrs. Sushma Swaraj take a proactive interest in finding the parents of Geeta and rehabilitating her. She brought her from Pakistan and whole media coverage and huge fanfare. There was supposedly a couple who were claiming to the parents of Geeta, but when their DNA profile was conducted, both the couple was excluded, both from the mother side also, the father side also. So the DNA of the Geeta was not matching in to both the couples, sorry, to the couple who was initially suspected to be her parents. So just like I told you, she was brought from Pakistan. Then because our honorable late minister was personally involved and emotionally involved, so she through a video message announced that whoever will be helping Geeta in finding her parents will be rewarded rupees 1 lakh. So after that, you can say around 20 30 people, couples, individual persons approached that the Geeta was their daughter, granddaughter, and the number of people claimed to be her daughter. But till date, because I was personally involved in the case, so I can share, till date DNA profile of Geeta has not matched with any of the claimants. So sometimes when the person could not come to Delhi to give samples, like in this case, the team from Indore district administration came to deliver the samples in a cold chain custody in my office. Then we further process it in along with the FSL people. So there were it was, and then again we used to went to the ministry to collect the samples of the claimant. So it was both ways. Sometimes we were going to the ministry or patients coming to our center. Sometimes the samples were collected at a distant stage and came to our department. But unfortunately, till now, we could not find the parents of Geeta. So it's me and Dr. Swati going to the ministry in the Honorable Minister's office to take the samples. Now, but sometimes you achieve success also. Our another department faculty was involved in this case. So a boy was missing since 2010 in Delhi, and it was finally found in a shelter home in Dhaka in Bangladesh. So a Mehboob, a resident of Simapuri, it is a borderline area in Delhi, was searching for his lost son Sonu, a 12-year-old boy since 2010, who vanished from the premises of house one night while playing. So family informed the police and a missing case was registered. Ultimately, the boy was not treated as per the procedure. Police closed the file in 2013. Then, after 6 years, information came to the parents that their child has been trafficked, was being trafficked to the Dhaka, but ultimately landed up at a shelter home. So he was then later investigation, he was found that he was kidnapped by a tenant living in his parents' house and trafficked to West Bengal, then to Bangladesh. Then ministry got involved, our government got involved, government proactively coordinated with the Bangladesh counterpart. They were also cooperative. Then the samples of the boy and the parents were taken. Again, our department was involved. The DNA test was conducted, which confirmed his identity, and he was reunited with the family members. So how DNA has to solve the crime? Just like I told you, unique in identical twins, similar to fingerprints, can identify victims. If without identification, a crime investigation cannot proceed. That it can link crime scene together by linking the same perpetrator to different scene locally, statewide, or across the nation. Because sometimes serial offender, or you can say serial criminal, serial killer, serial rapist, have this tendency to change the location. They will, because our legal system work in the jurisdictional, you can say jurisdictional based system. Like Delhi police will be responsible for the crime having in Delhi. Even in Delhi, you are all having 11 different police districts. So if you go outside Delhi, Gurgaon police will be responsible. So a crime happening in Gurgaon and a crime happening in Delhi, so there is, as such, there is no mechanism of coordination. There is their local confidential network is there, but if a correlation is not established, it is very difficult to link the crime scenes. So a few months back, I must share, you must have read in the newspaper also, I think not few months, just before COVID time, a person was assaulting young children from past so many years. He has assaulted many, and particularly all those children belong to the poor families. So he was assaulting children, and many of those were not reported also. Ultimately, he was caught in Gurgaon. Then he disclosed, from Rajasthan to Alwar to Ajmer to Delhi, he has sexually assaulted more than 100 children. So regarding in such crimes, DNA evidence is very much important to link the crime scenes. Then they can place an individual at a crime scene in a home, in a room, where that he's saying that I was not there, so I have not committed the crime. But if you find his DNA over there, that it is a proof of at least his presence in that room. Then it refutes a claim of self-defense and put the weapon in the suspect hands. Then coming to the further. No, just a hypothetical example or a very simplified example. A violent crime has occurred. The forensic team retrieved a blood sample from the crime scene. Then they prepared the DNA profile of the blood sample, the victim and the suspect. The suspect profile, which from an is this. The blood sample from the crime scene is in the middle, and the victim's DNA profile is on the extreme right side. So now we can easily see that the suspect profile is matching from the blood sample found on the crime scene. It means suspect was there, his blood sample, or you can say his blood tissue, was extracted at the crime scene. So he has a lot of explaining to do then to the police why his blood sample is found out in the crime scene. So coming to the, you can say, our main focus part, or you can say our very sensitized aspect of today's society, the sexual assault cases. So why the DNA is important in sexual assault cases? You will find NGOs and all those stuff, they were shouting to the government, increase DNA facility. Government is also working tirelessly from past so many years to increase the DNA facilities, and in fact we are also involved in the government project where they want at least every big hospital should have the DNA facility, so that the outcome of the DNA results could be quick and the survivors could get justice in a time-bound manner. So what happens in sexual assault? Generally, there is no witness to a sexual assault. It do not happen in a public place. It happens in closed room, closed circumstances, closed environment, and the only two individuals, or you can say only the two parties involved are, one is the survivor or the victim if she right, another is the accused. Accused might be single or multiple, might be both male and female also. So when the court goes to the court of law, the evidence is mostly circumstantial or the statement of the victim. So DNA there, at that stage, DNA provide an important scientific evidence for you can say in the confirmation of the guilt of the accused. So in sexual contact, the contact between the perpetrator and the victim or his environment or both always leave evidence which is transferred vice versa. The female will also the DNA of the female will also be transferred to the accused or the assailants, and both their DNA will also be transferred to the survivor or the victim. So why I'm not going into the details, because tomorrow it will be covered in the details ki what samples in what sample you will find in the examination. So I'm not going into that detail. And this is sometimes the only evidence which is against the accused in the courts of law, whether and particularly when the victim is murdered or incapacitated, like the unfortunate Nirbhaya incident we all have seen. So in such kind of cases, DNA evidence can make and break the outcome of such cases. And particularly nowadays, you must be reading in the newspaper, POXO cases, different courts are giving different judgment. Sometimes they are because it is very difficult to you can say rely on the testimony of a child, particularly when he is 5 to 6 years old, for the judges also. So DNA evidence in such cases can fatally make or break the outcome. And so it is emerging as an important tool in achieving the justice for survivors of sexual assaults. Now, this is the safe kit. Generally, and it is not a, you can say, rocket science in this safe kit. It's just a collection of simple items which are found in every nursing station and every emergencies, every ward stations. So, but because of the, you can say, for the, so that nobody forget anything, so the safe kit was designed, and it is now easily available on the GEM also. If some of our senior nursing officials are involved in the procurement, they can procure it from the GEM through the procurement channels. So coming only to the precautions for DNA analysis, what should be taken while preserving the samples from the victims? First of all, avoid destruction and contamination of the evidences. See, at least do what you should do your role perfectly. There are fallacies. There might be an error in the transportation also. There might be error in the laboratory also. There might be error in the interpretation also. But what we are supposed to do, we should do it efficiently and perfectly. So always wear gloves whenever you are examining a victim. Always wear gloves. Do not leave your own DNA on the body of the victim or the samples. Use disposable instrument or clean them thoroughly before and after handling each sample. Avoid touching the area where you think that DNA may exist, or your DNA may be transferred, or your DNA may contaminate. Then avoid talking, sneezing, and coughing over the evidence. Try to talk as low, or at least use mask till your evidence or samples are preserved and sealed. Avoid touching your face, nose, mouth when collecting and packaging evidence. Now, so it is very, you can say, effective in COVID also, that we should avoid touching our face, nose, and mouth as less as possible. Then before sealing it, or you can say before closing the test tube or the slide, first air dry the evidence and then then do their packaging. Then put the can you just go to the previous slide? Then put the evidence into new paper bags on envelopes and not in the used paper bags. And regarding this packaging, Dr. Venkatesh tomorrow will be explaining in detail. So I'm just skipping this part. Now, what's the benefit of preserving DNA samples in sexual assault forensic examination? First, just I told you, increases the chance of identification and an unknown perpetrator. Sometimes in 90%, I will not go by the statistics, but in most of the cases, the accused is known to the females that who has conducted sexual assault. But in cases of gang rape, like being abduction from the roadside, then sexual assault. So it increases the chance when the female also do not themselves know that who have committed the sexual assault. And sometimes in such a traumatic, after such a traumatic incident, they might not recognize the faces also, because rape is not a, you can say, crime to the body, it is a crime to the soul and the dignity of a female. Then number two, it increases the likelihood of holding perpetrators accountable in the court of law. Just I think I have explained this issue because DNA has more evidentiary value, and many cases rely on the first-hand accounts of the survivor and other evidences that leaves room for interpretation. Sometimes defense counsels raise, because they are duty bound to protect their clients, so they raise the uh, issues or questions about the credibility of the female survivors. They will charge about their dignity and all those stuff. I will not like to go into details. So DNA evidence helps build a stronger case for the prosecution against the perpetrator. Then coming to the third point, and the most important point, next slide. It prevents further sexual assault from occurring. See, just I told you, sexual offenders are not one-time offenders. They are serial offenders. They will continue their act unless they are caught. They might be continuing their act some in their families also, and sometimes in their blood relation also, sometimes to unknown people. But once started, they have this tendency to not stopping till they are caught. So as soon as you catch or you help the our legal system to catch such perpetrators or such assailants, the more number of, you can say, female, child, both male and female, you will save for the further assault. So a safe foreign, safe, we generally use safe. Safe means sexual assault forensic examination. So a sexual assault forensic exam and DNA test increasing the chance of taking the perpetrator off the streets from the society and preventing any further instance of sexual violence. And even sometimes, see, law has I told you, law is a matter of interpretation, and prosecution is based on evidence. Sometimes judges also know that this person has committed the crime, but the prosecution is not able to prove their case. But still, after the DNA of the accused is in the database or is with the police, so such it will act as a deterrent for him to commit further sexual assault. Now, coming to the YSTR testing, this is a little bit on the scientific side, but I still want to explain it. So, YSTR testing, see, just like I think somebody asked in the previous question, whether the victims could be male or not. Yes, males could also be the victims. And in the POXO, our act is gender neutral. In our POXO act, both the male and the female, it doesn't matter. Only the thing is the person should be of below 18 years, and that will be covered in tomorrow's session. So generally the accused are males in our country. So in males, the YSTR testing is unique to their DNA testing. So I'm just mentioning it here. So spermatozoa are a rich source of DNA, are responsible for a vast majority of the DNA content of semen. YSTR are, you can say, short tandem repeats are found on the male specific Y chromosome. So in a sexual assault cases, when you take the swab and smear from the survivor's genital tract, so it will be containing the female and the male DNA. And because you are taking the samples from the survivor, so by the common sense, her DNA will be more and the male DNA will be less. So when we go for the YSTR testing, it is sensitive and specific for male DNA. It's essentially able to detect like just a needle in the haystack. So even a small, minute DNA mixed with a large amount of the female DNA, the YSTR testing will be able to detect it. So since there is no YSTR in the female DNA, the only contribution of YSTR can only come from the assailant or the accused in sexual assault cases. The male component will be easily detected, and only that part will be amplified and led to the generation of the complete DNA profile. Then YSTR test system is extremely helpful when there are more than one assailant. You can identify each and every person who has committed the assault. Now, just like I told you, a old case which I saw in a documentary, there was a recent publication in which the Office of Chief Medical Examiner, from the Office of Chief Medical Examiner, archivers searched for sexual assault smear for all 376 female homicide from 1990 to 99. Out of that, they were able to detect, this was publication was done in 2019, and they went 20 years back. Till they were able to detect 13 sperms in the 13 slides of 13 cases, and out of those 13 cases, 6 were still unsolved. So after 20 years also, they were able to generate the DNA profile. Then they used the CODIS system, like US and UK are having efficient DNA database for solving the crimes. So they use the CODIS system and they get 2 match or hits, like for new suspect. In addition, 3 suspects were eliminated in 2 cases. So after their analysis, the sexual assault smear resulted in the DNA profile, and to assess the investigation in the 4 cold cases of homicides, female homicide, which were committed 20 years before. So just to give you an example of the importance of our sample preservation while we are working in the hospital setup. So this is a case in which I was personally involved, and there was also, like Dr. Milo sir mentioned a case of the Chitrakoot. We were very disheartened to see so many children assaulted by a one man over a period of so many years. They were very small children, and sometimes you have just like you could not sleep for 2-3 days. But the crime was not reported and they were not examined at the current time. So that person got assaulting the children like anything. So this is our case I was personally involved in. I conducted the postmortem, and it was, I must say, it was not less than the Nirbhaya case, which everybody knows. So a semi-clothed body of the deceased was found in a desolate space in a nursery in South Delhi in the Vasant Kunj area. So I've specifically but deliberately removed the photographs of the deceased because to protect her dignity, and it was very gross to be presented on an online platform. So she had been reported missing. She left. I personally remember this case because many times I was called to the court to give evidence. She was reported. She was working in a factory. She was supposed to go home, but she did not reach the home. Her husband was a physically challenged person. So then the next morning, her body was found in bushes between the Mehroli and Vasant Kunj in South Delhi. So the postmortem was conducted in our department, and she was having very, heinous and disturbing injuries. There were huge wooden sticks which were inserted through her private parts, and they were piercing her whole body, her organ system, her abdomen organ system. Even one wooden stick was reaching till her heart, starting from the genital tracts. So later on, a friend of the deceased, he was working as a gardener in a local nursery. He was apprehended, and it was found that it was ultimately the crime was committed as a result of jealousy. So he was in a physical relationship, but he still murdered the female and gave the appearance so that the police could be misguided that it is a case of a gang rape and sexual assault. He deliberately committed sexual assault on the female by tying her and then inserted the wooden sticks in her private part, particularly with the intention so that the whatsoever seminal evidence he has left during the sexual intercourse, that will be destroyed by the flowing of blood through the genital tract, and the police will be misguided that it is committed as a gang rape, just like Nirbhaya. So after the accused was arrested, he was brought to our department. His examination was separately conducted. So from that examination in the laboratory, his profile was generated. Then his profile was further there were unknown male DNA profile was generated, first from the seminal stain which was present on the shawl of the deceased, which was recovered near her body from the crime scene. And secondly, while conducting the postmortem, we recovered a red colored undergarment from the genital tract of the female, which the accused has deliberately inserted in his understanding so that his DNA whatsoever could be destroyed. So from that red undergarment also, which we recovered during the postmortem examination, the DNA was deducted, and both the DNAs matched with the DNA profile which was generated from the accused, which was after his arrest during the examination. So now I think this is and we have been involved in innumerable such number of cases. So sample collection, why I'm highlighting this, why I'm shouting DNA, 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 because the sample collection from the victim, dead or alive, is too much important. If you are not doing that part properly, ultimately the laboratory will not be able to analyze, and you will be helping an accused, which will further commit more crime and will be a more menace to the society. So sometimes it not only convicts, sometimes it gets justice to the innocent also. So a female reported a sexual assault by a cab driver. Then different samples were collected. Male profile was generated from the samples of the females, which she said that these were from the so-called accused. She identified the accused and told such and such person has been conducted a sexual assault. So after the analysis of, because we are having the short time, I'm not going into the details, but after the analysis of the relevant sample, it was found the person she pointed out, his DNA profile could not be matched with the samples collected during her examination and during the alleged crime scene. And what during the examination it was found that she and her husband were having some dispute with the alleged accused, and they wanted to frame in a false sexual assault case. So her husband did the act and inflicted the injuries upon her, and then she reported the matter to the police. Then coming to the next heinous crime after, you can say, sexual assault, is the murder. So again, in murder, in which a suspect can be identified, a sample of that person's DNA can be compared to the evidence of the crime scene. The result of this comparison may help establish whether the suspect committed the crime or not. So this is a Sheena Bora murder case. I think every one of us know too much media, huge influential people involved, media houses involved, and a whole lot of attention in the country. I was also involved with my department team. We went to the place also where the remains of the Sheena Bora was exhumed. So just like I told you, in the convictions, the first and the foremost thing is the identity of the victim. So till the identity of the victim is established, the prosecution cannot start the case against the accused. So luckily and fortunately, when the remains of the Sheena Bora were found in a jungle, she was an unknown skeleton. So the doctor who conducted the postmortem at the crime scene preserved some her tooth and a few of her bone parts, but they were lying in the laboratory. They were not examined. When the case became high profile, those samples were searched. Her DNA profile was generated. The DNA profile were matched with her biological parents, and then all the law-related procedure, arrest, and all those stuff started. So just this case is highlighted to importance of the DNA preservation in finding the identity of the victim. So few points are still to consider, like everything is not foolproof. Scientific auditing should be there. Ultimately, human beings are those analyzing the samples and making the DNA profiles. And again, DNA profile can, no doubt, they are very high, you can say, statistical probability, but they are still statistical probability. They are not absolute result. And DNA database stored in computer can be hacked. DNA evidence can be falsely planted at the crime scene also. And social and ethical issue can arise if the information is just like told you, a person's DNA DNA profiling is a very minute aspect, DNA profiling for criminal cases. But the person's DNA is having huge information. So I think it is a huge debate right now going in our country with the government and the all social media NGOs and the societies who want the civilian liberties. So social ethical issue is also there. So coming to the next aspect, that is mass disaster and the role of DNA profiling. So just like in criminal cases, mass disaster could be man-made also or could be natural also. Like COVID is the endemic, but mass disaster could be a disease and mass disaster could be man-made, like 9/11, fire, Upar fire tragedy. So in mass disaster cases, you might be reading it 1 day, 2 day, 3 day in the newspaper, but the families of the victim continuously live their life finding the answers. So when in those cases, DNA profiling is very helpful for putting an emotional closure to the family. I will just, because I think we are just about to run out of the time, I will just give you 2, 3 examples. So what is a mass disaster? A sudden ecological phenomena of sufficient magnitude to require external assistance. So in what mass disaster, what happens? Like Sarojini Nagar blast case, Lajpat Nagar blast case, air crash accidents. There is severe fragmentation, decomposition, and the intermixing of the remains of the victim. One person hand you will find somewhere, and his lower limb you will find in different hospital and all those stuff. So in such situations, traditional identification method like photography, anthropological and physical characteristics of the victims fail. Then in those cases, DNA profile becomes the only, you can say, way out and the gold standard for victim identification. So very recently, this was a Delhi hotel fire in Karol Bagh. Many people lost their loved ones. So again, the problem faced was can find it hard to identify fire victims, particularly in fire. I worked in Safdarjung Hospital also. There were daily 5 to 6 you can say deaths of burns patient, and all burns are medico legal cases, so they were subjected to postmortem. And in most of the cases, relatives were finding it difficult to identify the body once the facial features were distorted. And we had to rely on the hospital labels, hospital setups, and that is also one of the important aspect of the, you can say, forensic nursing, to label the dead bodies while shifting to the mortuary. So those labels were too much, you can say, reliable in identifying and distinguishing the burns victim from one victim to another. And who could forget 9/11? So the largest forensic case in the history, greater than 20,000 bone fragments were processed, greater than 6,000 female family reference samples and personal effects were analyzed. And coming to our country, like that Kedarnath flood tragedy, I think thousands of families are still searching for their loved ones. So I think with this note, regarding this, we have created a Ummeed portal. One of my faculty is the principal investigator, and we are also co-investigator. So this is a portal you can access on your mobile and on normal internet also. So we are creating this unidentified bodies and missing person identification portal and DNA database, so that we are taking small steps towards the larger goal. So by this, I think we are just 5 minutes short of ending the session, and I thank you all for being such a wonderful audience and participating in such huge numbers. Thank you.
Okay, thank you, Dr. Abhishek sir, for this such an elaborate, wonderful, and very informative sessions. I hope that all the participants have lots of questions and inquiry regarding this, because every one of us know much aware about the DNA, but what is that much of importance in that sexual assault that people might not be much aware about that. So thank you once again, sir. Ma'am, can we take up some few questions?
Yes, definitely. I think there are some questions posted in the chat box.
Okay.
Like within how much time the evidence should be collected in case of sexual assault. And Dr. Abhishek, it was very, very interesting session, you know. I think you need more time. You
Thank
can,
you.
these kind of examples we cannot get neither in Google nor from books, you know. It was so interesting, like listening to, you know, like watching a movie. Very interesting it was. Yes. So I think 2 days are not sufficient for such type of courses. We should have courses for a longer duration so that every concept can be explored with the live examples. Thank you. Shubhala, are you reading the questions from
I'm
chat
not able
box?
to access from here. Shweta, can you please read out the
Okay.
questions for us?
Yes, ma'am, sure, ma'am.
Yeah,
I'm
please go
reading.
ahead.
So, Prabhujot has answered, is DNA profiling is so important in today's world for scientific evidence in the confirmation of guilty. Why shouldn't it be mandated to include the DNA profile in every individual in our Aadhaar card to inside everyone in DNA database? Certainly help in catching the guilty.
See, this is a very, just I told you, this is a very debatable aspect because the DNA bill is currently, it has been again and again, the government is revising it from 2018, the initial draft was introduced, then in 2019 it was again revised, then again, in fact, our Honorable Home Minister introduced some part of the criminal identification system. They have just cleared a bill, and in that also many civil liberties group and the opposition raised hue and cry. And regarding the creation of DNA profile of each and every individual is, first of all, it will be a serious breach of the privacy, and it is also not allowed in any western world also. In well developed countries also, they are having specific index, like first of all they are having the missing index, the person who are reported missing by their families. Second, they are having a convicted index, like they take, if the person is being convicted by the court of law, then by the virtue of legislation his DNA will be stored in the system. But if the same suspect is exonerated by the court, his DNA is, the agencies have to delete his DNA profiling data from their system. Next, they are having the sexual assault, what should I say, accused DNA. So there also they are not they are not collecting the DNA of each and every individual, because it will, you can say, create a plethora box of problems and will create a huge I should not elaborate here, because it will create a huge problem for each and every individual. It's like giving the control of your life to few individuals with the authority and power. So I don't think this will be applicable in recent near future. In few countries I might share, like in Middle East countries particularly, if you are going as an employee, as an employment, particularly in medical, like, because being in medical profession, most of our doctors and nursing professionals are going to the Middle East countries. There I am having the first hand knowledge. They collect their DNA sample. It is contract of their employment and immigration that if you want to work in our country, you have to give the samples before you will be giving the work visa. But not for their own residents.
Okay, sir. So the next question is, good afternoon, sir. If in case of complete burned body, then there whether be bone, they can collect the DNA in case of rape and murder. Can be some can we differentiate victim and accused?
See, like I told you, whenever you are analyzing for DNA, if there is 5 DNA samples, each 5 profile will be generated. It will never be like if the victim of DNA and accused is there, so both the profile can intermingle with each other. So if definitely if there are 2 DNA profile or two cells from which DNA can be extracted, both the profile will be generated. Second thing, the first part of the question, no doubt in burned and charred remains, the extraction is very difficult. But sometimes when the bone is a hard structure, so when you dissect the bone, inside there is a bone marrow cavity. So in that the cells are there from which DNA can be extracted, and if you go through the Google and the newspaper, our department is recently handling a case in West Bengal Birbhum violence where the identity issue is being undertaken like this. So extraction is difficult, but extraction is, it is not like that extraction is impossible. But because with bones there might be muscle tissue also, and in tissue there are millions of cells. So but you have to do rigorous exercise, rigorous lab extraction, but yes, you can definitely generate from the burnt and charred remains.
Thank you, sir. So the next Sherin is asking how long it will take to generate DNA profile from a sample.
See, now to earlier it used to take 2-3 days, because one day to it used to take for the extraction, then laboratory steps and all those stuff. Now, because our labs are too much overloaded, that's why it takes long to process then the samples. Otherwise, for the processing of the sample, I think it hardly take 2 days to, you can say, generate a DNA profile, 2 to 3 days. Because now most of machines are too much automated, and the new technology being introduced daily. Sometime, and few of our machines are so much sensitive, like rapid DNA. They can generate the DNA profile within 2 hours to 6 hours. So it depends upon the quality of the machine, the amount of resources you want to infuse. No doubt our government has modernized all the FSLs and CFSL, and they have putting, you can say, expenditure and money and resources like anything, and asking the hospitals also to start the DNA lab. But you know, we are a population of 130, more than 130 crore people, and with a handful of labs, and thousands of crime being committed in each, I will not say country, in each state daily. So it's just the delay you might have read in the newspapers and the media. It's just versus supply versus the infrastructure.
Okay, sir. Sir, adding to this only, someone is asking, what about expenditure in DNA profiling?
See, the expenditure depend upon the infrastructure and the modernization what you want to infuse. For making a basic DNA lab, you could do very easily in about 5 to 10 crore of rupees. But your sample, you can say analyzation, but this is the basic establishment. Ultimately, you have the running cost you will have to calculate depending upon the samples which you want to take, the personnel, the hired personnel, the staff you will be required. So running cost is different. Infrastructure cost, from the small lab to small to mid-sized lab, you can establish it around very comfortably within less than 10 crore rupees. But for a high through output lab like FSLs and dealing with the hundreds of samples, then you need investment.
Thank you, sir. So then what level of confidentiality need to be maintained while handling sexual assault and rape victims?
See, confidentiality is not only which is supposed to be maintained, it is legally bound also. Dr. Karti, in his tomorrow's last, you can say, the presentation, he will be handling, talking about this aspect. We are, whether we are nursing orderly, nursing official, MBBS doctor, junior resident, faculty, even director, even medical superintendent, we all are totally legally bound to maintain the confidentiality, secrecy of the, not only the findings of the report, about the identity of the survivors also. If any of us breaches, then there are legal provision to for punishment in the courts of law. It will not like you will face a disciplinary memo or a departmental action. You have to face the police and the court as per the in the criminal provisions.
Thank you, sir.
Yeah, I think there is another question. If the victim is burnt, how to identify the victim was sexually assaulted? No?
See, again, it depends upon case to case. I can say there is no set of you can say calculative methods. It depends upon the expertise of the person who is doing the examination. Sorry, that's why in such cases medical boards are formed. In such sensitive cases, the police also, like like we are in AIIMS, we are having a big department with huge amount of expertise. So sometimes from Delhi, inside Delhi also, though every area is having different jurisdiction. If such kind of sensitive cases happens, then police refer to case to us or sometimes to Sabdarjung also. So there is no fixed formula. There is a very detailed investigation starting from the very minute examination, the external genitalia, many lab investigations, then going to the condition of the victims, then taking the circumstantial evidences, which are also important. Then finally, a holistic opinion is being derived in coherence with the investigators and the lab reports and all those stuff.
Right, there's mix of two blood samples, then
Yeah.
how to identify the victims?
No issue. A mix of two blood sample, two DNA profile will be generated. So the victim DNA profile will easily be, you can say, if the victim is alive, so she will give her blood sample. If she is dead, the postmortem samples are mandatorily preserved in the bodies in such cases. So even if the mixing of the blood, totally no issue. Easy, very easily to DNA profile will be generated. Even there will be mixing of 10 samples of blood, then also 10 DNA profile will be generated.
Yes. And what about in case of identical twins? Is also one of the questions.
See, in identical twins, which means a ovum which is fertilized by a single sperm, if later on it divides and two twins are born, then their DNA will be same. But then again, their fingerprinting, then their hand fingerprint will be different. So, but monozygotic twins are not very common in our, you can say, medical practice.
Yes. Any more questions are there?
So, if the crime is highlighted by social media, how is confidentiality maintained in such situation?
See, if somebody is breaking the law, we should not be concerned, first of all. Let anybody break the law, they will answer for themselves. Like being in a medical profession, working in a government sector, or not even government sector, even you are working in a Max, Apollo, even in a small clinic also, same law applies to each and every individual. So as a medical professional, we will stick to our role, our confidentiality and our secrecy. If we will make sure that none of the information should be disclosed from our side or our role or our, you can say, negligence or our carelessness. If the media is highlighting, let them highlight. It's their domain. They can do it. Government will take care.
Yes. Yes.
So then, who will be the first person to collect the evidence of for any sort of MLC?
See, the system differs in, just I told you, in different setups and different organization and even different country. Like just like our first speaker, who is the president of International Association of Forensic Nursing. In our legal system, doctors, I told you, is the whole soul accountable. He might take assistance, but ultimately accountable resides on him. Okay. But in the international systems, there is a level of examination. The forensic nurses will do their examination and sample collection, like nail clipping, hair combing, swab taking. They will in that report they will said ki we have taken this, then we have conducted this examination, we have found this injuries. Then they sign it. Then a doctor comes for a short duration. He just supervises all the things, whether the sample has been taken. He further adds to them, makes some more examination or confirms the finding of the forensic nursing, and then countersigns it. So this is the main concept of forensic nursing, which is introduced in Western countries, because they are not having huge manpower like our country. If you go to their hospital, you will find one forensic nursing catering to 3 different hospitals. So, and then coming to our country, if you will go to the remote setups like CSCs, PSCs, where most of the time doctors might not be available, in small centers, Anganwadi, and victim could, and the victim do not know jurisdiction, victim do not know which hospital should I go, so they can report anywhere. So in those centers, nursing professionals are very well authorized to take the samples, and then they will report whatsoever. The main thing is documentation. Whatsoever you are doing, just document it, sign it, and give it to the next available doctor or the next higher authority. And in big hospitals, so we do not have such problems, because any of resident doctors, faculty, they are available round the clock. So I think it depends upon setup to setup also.
Sir, thank you, sir. So there's the last question, sir. Maximum duration after which sample can be collected at the site of crime?
See, if the samples like blood sample, etc., they can be collected for a good number of days. It is not like any kind of a fixed, you can say, mathematical criteria. But sometimes though, after many months also, you will find if the blood stains have been properly dried, you will might find and extract the DNA from them. The issue particularly is regarding the body fluid, particularly in sexual assault cases, regarding seminal fluid, which is left in the female genital tract. So from the very moment the sample or you can say the seminal fluid is extracted into the female genital tract, from very moment it starts decaying, just like any body fluid. So you must have read in the newspaper or seen in the movies also, they said the victim should not take a bath, etc. So as soon, the best advisable is to report to the nearest hospital, nearest dispensary, nearest center as soon as possible. So the probability from the day of collection, the probability will start decreasing, and generally it is very difficult to find seminal stain or DNA extraction after 72 hours. But yes, there have been cases in which after 4 to 5 days also the DNA have been extracted, but again it, because it is a biological based science, so it decreases with the time.
Thank you, sir, for all the answers and your insights. Thank you so much, sir. Over to you, ma'am.
Okay.
Yeah, I think it was the discussions were very interesting, and it was totally an unexplored area by nurses. And some nurses have written in the chat box they are not allowed to collect the evidence, especially in community health centers. In the remote areas, only nurses are there. In community health centers and primary health centers during odd working hours. So if they are not allowed to collect the evidence, then how we will be able to support the justice?
Yes, ma'am. That is the basically by method of this, you can say program. This is just an initiative. And by this, we can continue this to make changes in the, you can say legislation or MOHFW guidelines, or MOHFW can authorize the nursing professional to at least for the sample collection and the preservation.
Yes.
Then it will be a huge benefit not
Yes,
only to the
standing
victims but
orders
to society
that nurses
also.
can collect when in remote areas. Yes, yes. Yeah. So I think it is continuing. The questions are pouring in. They are asking if the evidences are tampered, no, or tampered. Then how we will establish the truth, no?
See, tampering is such an issue which is, you can say, human originated, or human beings are involved. So in such cases, the evidences are, I'm not denying it. Sometimes in high profile cases, or you can say influential people, such things happen. But the thing is to maintain a total chain of custody and secrecy. Like the person who is collecting the sample should not know where the sample is going. There should be just like a barcoding to that sample, and the barcoding, the details of the patient should not be mentioned on the sample. In fact, the police person, the investigating officer of the case, should submit it to a third person who might be sending it to another laboratory in which the first police person will not be knowing. But the thing is that all these things require a, you can say, huge revamp of the system. But for the tampering, we could again take the samples. If somebody has some dispute, we can again take the samples and again analyze. Because for such kind of, you can say, effective functioning, first we have to coordinate the hospitals, the police, the central police, senior police officers, the FSLs and the home ministry. We have a total, we need to have an interlinking of all these different departments to make a totally, you can say, blind passage of the samples.
Yes. So, and I think we will stop with this. Ideal temperature for preservation of samples is one question. In case of rape, if the rapist is wearing the condom, then how we will collect the DNA sample?
See, if the rapist is wearing the condom, this question will also be answered by Dr. Kulbhushan tomorrow, but still I am answering it. If the condom is recovered, so from the condom we could either extract his DNA. Second thing is, whenever sexual assault happens, there is a huge amount of DNA exchange between the female and the accused. Okay. So his DNA might be found under her fingernails. Her DNA might be found under if he is touching her private parts. So there, or if he is scratching her, so her DNA will be found under his fingernails. So it's not only like seminal stain which is used for the DNA extraction. There are many number of cases we take the swabs and sample from the outside of the genital area also. He might have, you can say, bite the female. He might have used his tongue. So depending upon the history, samples are taken from different area of the body. There are multiple places from where DNA can be extracted. And regarding the temperature part, just like I told you, some precaution. So when we are taking in a swab and smear, so once you air dry it, then you do not need to go for the cold preservation. But when you are preserving the actual body fluids like blood, or you can say actual seminal stains, or sometimes like in hospitals, few like our nursing officers who are working in the gynae OTs, they must have seen. Then sometimes in minor rape cases, abortion happens, and those samples are quickly handed over to the IU. So when the body live body fluid is there, so that needs to be transported ASAP to the lab. The ideal storage condition are 4 to 8 degrees Celsius, just like a normal body tissue.
Yes, yes. Yeah. Thank you, Doctor.
Thank you, ma'am.
I think we thoroughly enjoyed listening to all the speakers, and I think the questions will be continuing. We have gone beyond time. So thank you very much. And participants, please stay tuned. Tomorrow also we have the session. We will clarify a few of the questions tomorrow. And many are asking for the link for post-test. Post-test link will be shared tomorrow at the end of all the sessions. So today we do not have post-test. So stay connected, join us tomorrow, and you will be listening to all the other aspects of forensic nursing, which are going to be equally interesting. Thank you, Dr. Abhishek, not only for this session, for coordinating the entire event.
My pleasure.
Thank you so much, ma'am, once again. And I would like to thank Dr. Abhishek, sir, really for clarifying all the doubts and just for making such a wonderful session. And one more thing, one request to all the participants: if you are not able to answer all your queries right now, we still have tomorrow. So you can just write down your queries in the chat box, and we'll try to answer you back by tomorrow. So with this, we come to the end of the first day session for this faculty development program. And I request all the participants to be joined by tomorrow at 9 o'clock. With the separate link will be shared with you guys. And we hope that we'll have a very good learning. And we have the very expert speakers again tomorrow. We have another 5 speakers and with the different areas of expertise, and they will be sharing their views and their experiences. That will be quite interesting. So I'd request all of you to join tomorrow also. And with this, I would like to thank one and all who are present over here, and see you tomorrow again. Thank you so much. Thank you, sir.
Thank you.